Okay, good afternoon, everybody. Welcome to the work session of Las Cruces City Council. Today is Monday, March 9th, 2020. It's approximately 1 p.m. Before we begin, if you please join me in the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And now, Udell Vigil will introduce our Pet of the Week from our Communications Office.
Thank you, Mayor, City Council. Jennifer Martinez has the afternoon off. That's why you're stuck with me. But I am happy to do it because our Pet of the Week is Princess. And this little cutie has honey-colored eyes. If you look closely, you can see the colors of her eyes. And she's got a great poise and great demeanor, which makes her a great canine companion. And you can meet Princess, who's almost 8 years old, at the Animal Service Center of the MESILLA Valley. Hours are weekdays, noon to 6, weekends, noon to 5. They're located at 3551 Baton Memorial West, and their phone number is 575-382-0018. Offsite adoption events this weekend: Saturday, Farmers Market at the north end of the downtown mall, 9 a.m. to noon, and Nissan of Las Cruces, 11 a.m. to 3 p.m. Reporting ordinance violations involving animals, what we ask you to do is call Central Dispatch, which is the non-emergency number, at 526-0795, and use option number 6. Provide the following information: the location of the infraction, the type of offense that it is, a description of the animals involved, and your contact information, including your name and phone number. Thank you very much, and have a great work session.
Great. Thank you, Udell. We appreciate it. Okay, we have 4 items on the agenda. First one being the coronavirus preparedness, and I believe Fire Chief Enriquez will be making that presentation, and there's going to be a few others from the community that are going to be able to kind of share with us what they're doing as well. And a nice hello to former Councilor Jack Ekman in the back. Thanks. We have a couple seats here empty. If you'd like to check. Actually, Mayor Pro Tem Gondaret will be here around 2, and Councilor Sorg is out of town in Washington, and Councilor Vasquez is coming down with the cold, and he didn't want to get anyone sick, so that's why he's staying home. So thanks to Councilor Vasquez for that. What? Well, we don't want him to endanger himself even further.
Good afternoon, Mayor and Council. Eric Enriquez, Fire Chief for City of Las Cruces. Today we have a presentation on the coronavirus preparedness. What we have is Claudia Alexander and her assistant will come up and give a presentation from the Department of Health. And then we have Dr. Bowles from NMSU Clinic to say a few words. And then we'll bring our EMS coordinator, Shane Mouche, to talk about some of the things with LCFD and what our response will be with the coronavirus in anticipation. We also have other members from the community here, from Mountain View Hospital and also from White Sands Missile Range. But the presentation will start with Claudia Alexander.
Thank you, Chief. Thank you, Claudia, for coming here today.
Thank you for having us and giving us this opportunity to come and talk about what the Department of Health is currently doing with
Excuse me, can I have you state your name, please? I'm sorry.
Oh, yes, I was getting to that, sir. My name is Claudia Alexander. I'm the Southwest Region Emergency Preparedness Specialist with Department of Health, Public Health Division. And along with my counterpart, Bernadette Gutierrez, Southwest Region Nurse Epidemiologist, will be presenting today about coronavirus. Some of the topics that we'll cover during this presentation include what coronavirus is, excuse me, symptoms associated with the disease, transmission, a current situation update, Prevention, more towards gearing on non-pharmaceutical measures that the community and our partners can do. So it is important to disclose that a lot of the information that is in this presentation has already changed. It is also important to realize that Department of Health is the lead state agency that will be coordinating response efforts with regional local partners. And I know we've all heard about coronavirus. It has been a very in the mode, if you want to call it like that. But I think in order for us to address some of the issues, some of the responses that Department of Health has, it is important to have a solid background with information that has been obtained from CDC and World Health Organization. Therefore, coronaviruses are a large family of viruses which may cause illness to humans or animals. The new strain or novel coronavirus emerged in the late November, early December 2019, and it was first identified in persons that visited animal and seafood markets in Wuhan, Hubei province in China. And these individuals experienced viral pneumonia. So before coronavirus, we knew that there were 7 different types of strains of coronaviruses. 4 of these strains have the capability of giving common or mild symptoms. Then we have MERS and SARS, which were identified later on. And these type of strains have the potential of causing more serious illness. With coronavirus, we are still uncertain because as we have seen, there's people that develop a mild form of the disease, and there's other people that develop a severe pneumonia. A lot of the symptoms associated with COVID-19 are pretty much what we can experience when we have a common cold or the flu. But the key is if we have a dry cough, have shortness of breath, and a spike in temperature. And of course, if we have traveled or if we've been around people that have been confirmed with COVID-19, this might raise a little red flag for us. These symptoms usually are mild, but then begin to progress. Most people will recover without needing hospitalization. However, we are learning that older people and people with chronic health conditions are at risk of developing a more serious type of illness. So how is COVID-19 transmitted? Well, it's transmitted person to person via droplets, especially when we're close to the person that has been confirmed with coronavirus. Guidance from CDC and Department of Health do recommend using airborne precautions to include eye protection. The incubation period for this strain ranges from 2 to 14 days. And as mentioned before, this situation keeps evolving. As of this information was as of March 7, we now know that this has changed. Over 100 countries, including the US, had confirmed cases of coronavirus. Right now, as of March 8, there are 423 total cases. 322 are under investigation, and 35 states, including District of Columbia, have reported cases. From these, we know that 49 positive confirmed tests have been from people that have been repatriated, 72 are related to travel, and 29 person to person. We now know that more states are being affected, or at least more states are doing more testing to confirm or the possibility of coronavirus. We know that Washington, California, and New York are the states that have taken the most of the cases. In New Mexico, we have 0 confirmed cases, which is nice to know. But in addition, as of March 7, 46 people underwent testing for coronavirus. From those 46 cases that were reported, all of them were negative. And because we know that this is a new strain of virus, or at least a virus that now has jumped into infecting a human, we don't necessarily know how it will react. We don't have a vaccine. In order for us to receive that vaccine, it's going to take some time, maybe 12, 18 months, just because there's a lot of trials that have to undergo prior implementing a vaccine regimen. Therefore, what we could do is have non-pharmaceutical measures that can keep us safe, and not only for COVID-19, but also other diseases such as the flu. If someone is sick, please make sure that they are staying 6 feet apart. You try to stay within that space. If you're sick, please try not touching your eyes, your nose, and mouth. Also, if you feel like you're sick, please take care of yourself, stay at home, take care of your other coworkers. If you sneeze or cough, make sure you have the proper cough etiquette, cover it. If you're using a tissue, make sure that you dispose that tissue immediately and wash your hands. Clean and disinfect the objects and surfaces using regular household cleaning supplies. As of now, we don't know how long the virus has the potential of staying on surfaces, so it's just always good practice to just go ahead and wipe our surfaces once we're done. The most important takeaway here is wash your hands for 20 seconds.
Thank you for that, Alexandra.
I'm Bernadette Gutierrez. I'm the regional nurse epidemiologist for the Department of Health, and I'm going to talk on where Claudia left off here about the laboratory testing and the vaccine, which she touched on briefly. So here in the state of New Mexico, I don't know if you guys read it in the news or not, we do have the capability to test for coronavirus. As of now, the testing is still being done at the state lab in Albuquerque. Once those samples are collected and sent to the state lab, they are also sent to CDC for confirmatory testing. It's my understanding this week that we should be getting the okay for commercial labs to do testing. Hopefully that'll be pretty quick. So the ones that we have around town, Quest, Diagnostics, Tricor, some of the main labs will be able to do coronavirus testing. I don't know if you've all had a chance to look at the CDC website. As Claudia mentioned, the information on there is changing rapidly, so they're developing guidelines and updating guidance for clinicians, labs, health professionals, anybody that's going to have to deal with the public, schools, and they also have special resources for handouts and prevention posters. Okay, so NMDOH has a preparedness and response, and as you can see, it's divided into 3 categories. So the first one is for communications. The Department of Health has been sending out weekly and or daily health alert networks to all our providers and hospitals in the event that there's new information that needs to be distributed regarding patient treatment, management, and reporting. They are also giving weekly press releases, and NMDOH has also developed a web page or a frequently asked question web page on our website, and anybody can go there and access information about COVID-19. The preparedness response in the middle, in the blue, is DOH is currently revising their pandemic influenza plan for COVID-19. And I don't know if you all remember in 2009 during the H1N1 outbreak. The plan is based, and we're using it and updating it for COVID-19. Part of the preparedness DOH is doing is we're contacting our hospitals and clinics weekly to check on beds and personal protective equipment and supplies. And we're also meeting regularly with our hospital, schools, EMS, and other local agencies to help coordinate the response. The epidemiology and testing available right now, as I mentioned, we are currently monitoring people who have traveled to any of those high-risk countries for 14 days. We have established an EPI hotline, so if any of the providers or hospitals identify a person anywhere in New Mexico they suspect of having coronavirus, they can call this number and get information regarding testing and management for that patient. Right now, if we do have people that present with COVID-19 and they are not ill enough to be hospitalized, we're recommending that home containment for those patients, that they stay home until they're well. We're also contacting at-risk travelers, screening them and asking them daily to monitor themselves, and we're checking in for respiratory symptoms. Okay, so these are people that have traveled to the high-risk areas. And then, as Claudia mentioned before, current at-risk travels include travel to China, Korea, Iran, and Italy. That's it. Thank you.
Thank you, Bernadette. Do you have any questions, Council, of either Bernadette or Claudia, Alexandria? Or, yeah. Oh, yes. Councilor
Thank you,
Flores.
Mr. Mayor, and thank you, Bernadette, and thank you, Alexandria. So as far as the health alert notices, it's websites, newspapers, and I'm wondering about, I mean, New Mexico has its population scattered throughout, and I'm wondering if people who perhaps do not subscribe to a newspaper or do not have a computer, how are they receiving the information as it comes? And then as far as monitoring, only those who, excuse me, only those who are returning from those 4 targeted countries, Iran, China, South Korea, and Italy.
Correct.
What about people, I've canceled all my flights, but in fact, I was writing a note I left one out. I'm canceling all my flights through August, just because, and some are domestic,
Right.
but in domestic flights, like Denver, flying to Denver and then connecting to another,
Right.
because we, out of this part of the world, here in El Paso, we take El Paso, and every flight has a connection. I mean, the only flight that doesn't have a direct flight to Denver, but you get to Denver, and Denver, if either of you have been there, it's wide open.
Right.
So people who coming from all different parts of the world, from Munich or London or whatever, are, and of course, Munich especially is very close to Italy. And then the European Union, you have one passport, you don't have to, there aren't any borders in that regard. So is there any alert as to that kind of travel or domestic travel? I know that Dr. Landon, I think, was here Friday.
Yes.
And he was saying that flights have dropped. And if you go online to get a flight, they're dirt cheap, but everybody's turning them down.
Right.
So those 2 questions, please. Thank you.
How that works is actually if somebody is identified, let's just say they go see their provider or go see their hospital because they're ill, they're actually interviewed by my department. I'm an employee of Dr. Landon, so that's what I do. But if we identify somebody that has flown like that, we actually contact the CDC quarantine station, and what we do is we work in collaboration with them to actually contact those patients or those other people on that flight to let them know that we may have a suspect and or a confirmed case of somebody that had coronavirus. Is it a very real possibility, right? Because we have people that are traveling from other infected states, right, all over the United States. So as part of New Mexico's case investigation, when those people are identified, we do talk with them, we do gather all that information, and any subsequent contacts or people that need to be notified, our office is in charge of doing that. Right, so that way we can tell them, hey, you need to be under quarantine, or if you develop this kind of illness, then you need to see your provider for an evaluation.
And
As
what
far
about
as-
our outlying communities?
I'm sorry?
Our outlying communities are people who don't have access to a newspaper or,
Right, actually,
Computer.
did you want to answer that question?
Before we move on to that question, it is important to note that CDC does have 20 different quarantine stations throughout the U.S., and that is what they are doing right now. They have different teams being deployed to the biggest airports, and they're screening for people right now. So anybody that's incoming in from an international flight will get screened and will be placed on self-containment if it is required, but that goes across the U.S. To answer the first question, we are doing a lot of community outreach. One of my jobs is to reach out to emergency managers from the different from the counties that I am assigned to, and we are going to give them presentations, talk more about what they can do to protect themselves. For example, on Friday, we will be going to Anthony and we'll be talking to our promotoras. This presentation will be completely disseminated in Spanish. It will be disseminated.
You want to kind of talk in front of the mic? You need to, there's a kind of infrared little thing that spots you there.
So those are the efforts that Department of Health is doing. We're in constant communication with our hospital emergency managers, our emergency managers for each county, and then they are the ones that are gathering these people so that we go and reach out to them.
thank you very much.
Thank you, Claudia. I incorrectly called you Alexandria, so I only listened to Counselor,
okay.
I just
That's
listened to
okay.
Counselor Flores. She said Alexandria, so.
It's okay, thank you.
Okay. Any other questions? Oh, yes, Counselor Bencomo, Counselor Beta-Stubbe. Oh, Beta-Stubbe and then Bencomo.
Thank you, Mayor. Thank you, Ms. Gutierrez and Ms. Alexander. I have a few questions starting out. When somebody is suspected that they have this virus, or we also know it's still flu season, correct? RSV, those types, yeah. How long is it taking, say somebody in our own community gets it from the time they get tested to the time we're seeing the results back on if it's a confirmed case or not?
My understanding it's been 24 to 48 hours, but there's a couple of different levels of coordination we got to do, and depending on which route you go. So let's just say that you're acutely ill and you show up to the hospital. Right now, the testing is only being done at the state lab. So once that person's at the hospital, those specimens get collected and then they get shipped up to the state lab. Usually the state lab gets them by that evening, and then the testing commences that morning. And then usually by that afternoon, we typically have the test results by that time.
Okay. When we start, or if it starts that we're able to do testing locally, what do you think that time frame will look like then?
I think it's actually going to be way shorter. And if we have more commercial labs, I think that's going to ease the burden off the state lab. And I think we ought to be getting labs pretty quickly on those individuals. So.
Okay, thank you. And when we take a look at our at-risk communities, those with the chronic conditions, perhaps the elderly, are we seeing that this COVID-19 is acting far, far different than it does similarly to like the flu for these populations, or is it sort of in line with what's going on?
It's actually sort of in line with flu and some of these other things. As you know, when you guys have comorbidities or other health issues, your immune system's not working properly, and so flu or any virus or any bacterial infection is going to take advantage of that. So.
And I think for our listeners, what would you say are kind of those top risks that people need to watch out for if they have these? Like if you have asthma, heart conditions, what are those top ones do you think that they need to be aware of?
Yes, just because the way the virus attacks your system, it goes and produces a lower respiratory tract infection causing the pneumonia. So you want to make sure that if you have asthma, history of allergies, you want to make sure you take care of those. People with heart conditions also have been identified as high-risk individuals. And you can find more of that information under World Health Organization situation update with the coronavirus. And you'll find all of the criteria. But yes, anybody that may have respiratory issues, heart issues, are more at risk. It is uncertain how this virus will attack people that live with diabetes and other chronic health conditions.
Okay. And how long do we think somebody might be a carrier for? I think our Chief Enriquez has talked to me about it a little bit. When we have some of our first-line responders going in and out of different facilities, they may be a carrier. And how long do you think that might be in their system for?
I actually got asked this question this morning, and to be honest with you, there's not enough research yet for us to give you that answer. We do know people, even a few weeks out, are still shedding virus, and the CDC and World Health Organization, some of these other people are still testing that. So I can't really say that we have a definite answer for you. The peak time, like Claudia mentioned earlier in her slides, usually 2 to 14 days when we see people being most, I guess, contagious, because that's a word I'm looking for, but we don't know enough yet afterwards, because we still see people that are shedding virus. It might be at a lower level, and so, but that doesn't mean you're not infectious either. Okay.
Thank you. Another one, you touched upon it briefly about the PPEs. And are we in constant, I would say, communication with our local hospitals to make sure that we have the needed resources? I know people are stockpiling things, and so could you just talk more about that, please?
So the Bureau of Health Emergency Management every week requests all the hospitals of all the regions for the whole state to provide an update on the hospitals of their beds, their PPE, anything that will be used for a response. So that has been, as a matter of fact, I had to submit for our Southwest region, our local public health office, we had to submit an inventory of what we have available in the events that we need to respond. We are ready to go.
Okay. And I know maybe for later, if one of the hospitals would like to comment on that, what they're doing. And I have one final question for you all. We've talked a lot about how it's affecting children differently. Would you care to expand a little bit upon that and why they think it is so far?
We looked at the CDC literature this morning about that issue, and I don't think that they know why it's not infecting children. Typically, usually children are classified in that high-risk population that we just talked about with heart disease, diabetes, but for some reason they're not. I think that's what they're taking a closer look, is find out why children are not getting as ill from this.
Okay, thank you. Thank you, Mayor.
Thank you. Councilor Flores.
Thank you, Mr. Mayor, and thank you again. As far as the testing goes, I know that I heard several things over the weekend on CNN with our spokesperson at the White House, known as the President, saying that that testing is available. You want to take a test, go ahead, and then his VP saying, well, actually, we don't have enough whatever to do the testing. Right. So, and then I don't know who, or maybe it was another commentary and I turned away, but, or maybe I was having a nightmare, that it costs $3,000 to have a test. So there's stuff like that circulating. So is there enough, excuse me, so do we have the capacity here in New Mexico to perform the testing, and is it going to cost people? Because a lot of people do not seek any help whatsoever. Right. A lot of people may be thinking just a bad cough or a bad, they're just having some guck or something in their lungs and not seek it out because they might not have health care coverage or that sort of stuff. So is there anything that's going out there encouraging people to go and get tested or see a doctor?
There is
Thank you.
capability right now, as I mentioned, through the state lab for people to be tested. So if we do have people that show up to the hospital or they're identified by their doctor, and we think that they meet the criterion, that testing can be done through the state lab. And when we're requesting the testing, that testing's usually free, okay? Once the commercial labs open up for testing, to be honest with you, I haven't looked or heard how much the cost of a coronavirus test would be, but I wouldn't be surprised if you're telling me it's $3,000. I wouldn't be surprised. And that's going to be up to those companies to decide how much they're going to charge. What we've been hearing likely is that may or may not be covered through insurance, pretty much just like any other flu test or things like that, but I think that's still to be determined at this point. So, does that answer your question? Okay.
Yes, you did. Thank you very much.
Yes, Councilor Bencomo.
Thank you. Thank you both so much for your presentation. You mentioned non-pharmaceutical interventions. Could you expand on that? Like, what can the city be doing to minimize fear, but also minimize and prevent spread?
During this weekend, I received an email that says, if you're an elder or if you have any chronic conditions, avoid any gatherings. Now, it is important to realize that New Mexico does not have any cases, which is good for us. But some of the measures that you are seeing implemented in other states, such as Washington, are because they have community spread, and that makes it a little bit more complicated. Avoiding mass gatherings is one, and just the personal hygiene, hand washing, that doesn't, like I mentioned earlier on, that doesn't necessarily only happen with COVID-19, but with almost all of the diseases. Washing our hands for 20 seconds, having the cough etiquette, that has been implemented, I think, for the longest time, and it was brought up during H1N1 a lot also. Just blowing our nose, make sure that you dispose of that tissue immediately and immediately wash your hands. If you're sick, just avoid going out. If you're sick enough to where you feel like you have some of the symptoms and you do meet this criteria where you have been either living with a person with COVID-19 or have traveled to these regions, by all means, I would suggest contacting your doctor, calling the Department of Health for further guidance. They will be the ones that will guide you through the whole process. If you are a suspect, like Bernadette mentioned, you will be monitored. And if you're not sick enough to where you need to be hospitalized, you will be told, please stay at your home. CDC was providing, or I believe they still are providing the travel kits. And basically they record their temperature and if they have any symptoms associated, if they are suspects. They do it for 14 days, and if everything is fine, then they give them further guidance. It's the same principle that Department of Health is currently doing.
Okay, thank you. That's really helpful. And I hope we don't get here in New Mexico, certainly, but in the event that there is a confirmed case, is the Department of Health prepared to release a different kind of preparedness plan at that point regarding events, schools, those kinds of things?
Yes, actually, my department is, we're actually working close with all those agencies. So it's going to depend on a case-by-case
Right.
basis, right? And the number of people that we see ill, the number of contacts, things like that. We do work very closely with all the hospitals, with the schools, pretty much everybody. And so we have any of those agencies contacting us or vice versa, that we can give them some more guidance as to
Great.
what we're going to do as far as school closures and things like that.
Great.
Okay.
So if an individual is experiencing some sort of, I mean, these are really common
Right.
symptoms. If someone is experiencing them, are you encouraging them to go to urgent care, to go to the doctor?
We're actually encouraging them to go see their doctor. We'd like them to call the doctor, especially if they have that history that she was just talking about. If they've
Okay.
been around somebody that's had COVID-19 or they've traveled to a high-risk area, we don't want them walking into an ER, right? We want to know that they're
Right.
going to come so we can make the appropriate arrangements to move them to an area where they're not going to be exposing everybody. And the same thing with the doctor's office too. We want to coordinate that with the doctor's office. You know, they're seeing other patients as well in their clinic, and we don't want to be exposing everybody into this. So our goal would be to educate somebody to know that they should call first before they come in and visit
Great.
and see. Yeah.
Great, that's a good thing to say for folks listening at home. I don't know who this question belongs to, if it's you or perhaps Chief Enriquez. I'm really concerned about again, hopefully it doesn't happen, but in the event of a confirmed case or even an outbreak, do we have protocols from the Border Patrol regarding checkpoints, regarding access to medical care for people outside of the checkpoints that are closer to medical facilities in Las Cruces? And enforcement?
I'm not real sure about that.
Can we check with somebody on that? I would be really interested in ensuring that the priority is that people get access to medical care before enforcement.
Sure, we can do that.
Great, that would be really good. I think that's it for me. Thank you so much for everything you do and for putting out all this information.
Thank you.
Okay, great. Any members of the public have any specific questions to ask these two ladies? Okay, great. Chief, so the next one up is, I guess, Dr. Bowles from MSU.
Yes, Mayor and Council. Next, we'll hear from Dr. Bowles from NMSU Health Clinic.
Good afternoon. My name is Dr. Judy Bowles. I'm the medical director at the Aggie Health and Wellness Center on campus at the New Mexico State University. I thank you, Mr. Mayor and Council, for the opportunity to be included in this forum. With 14,000 plus students, we are a little city in our bigger city, and it's nice to be included. We are a very international community. We have a large population of students studying on our campus from many different countries in the world. At any given moment, we have our own students, staff, and faculty who are coming and going in international travel as well as domestic travel. We have an extensive study abroad program for our students, and at present we have 30 NMSU students who are out and at other parts of the world. 3 of them were in Italy, and at the recommendation of our international office, 2 of them have come home and have been under voluntary 14-day quarantine in their homes, 1 in El Paso and 1 in Truth or Consequences. To date, they do not have any symptoms of the coronavirus. Presently, we have 4 students studying in South Korea. We have not advised them yet to come home, but our travel office is working with them every day, keeping them abreast on the current recommendations for that country. Our international office is also looking at 4 large student trips that are planned for the very first part of the summer to various parts of the world, including Italy, and will be, as the virus evolves, making recommendations whether those groups will be going or not. So we have a very international community. Our philosophy on campus is calm anticipation with a focus on prevention and preparedness. NMSU has an all hazards emergency operation plan. This plan has been in place on campus at least since the H1N1 days. It deals with all types of emergencies, and now we are applying it to the COVID-19 virus. It encompasses smaller plans within it for all departments, including housing and dining, athletics, classes and academics, travel, as I mentioned, human resources, and activities and events. It's divided into 3 levels, level 1, 2, and 3. Right now, the university is at level 1, meaning we have not found a case of coronavirus, meaning the state hasn't had a case of coronavirus. So at present, it's business as usual. We've not canceled basketball, we've not canceled concerts or any classes, and we're just trying to do our regular business. We have a communicable disease resource planning committee, which has met, made sure everybody's plans under the emergency plan is intact, and will be meeting monthly or more often if we need to as we address coronavirus. We also have CART, which is our Campus Administrative Response Team, which is an advisorial committee to the president. And we met last week to put preparation and prevention into place. At the Aggie Health and Wellness Center, with all the media information and news, we've just opted, like these representatives from Department of Health have said, to follow the recommendations of the CDC, the World Health Organization, and the Department of Health. I evaluated 4 students myself last week who had medical symptoms consistent with coronavirus and a soft travel history, and I can testify that our Department of Health was right there when I caught them, and were very helpful in giving me advice and counsel on helping these students. At our center itself, our nursing supervisor and I, working for a large bureaucracy, tried to put together a policy of how we were going to manage coronavirus, and it's very difficult to make a static policy on a dynamic virus. We have our regular sanitizing, cleaning procedures into place. The university has added to our armamentarium these sanitizing misters that now come and clean all of our chairs and surfaces in our exam rooms and our lobbies. We have our PPE, and we're working with our supplies on that for the Department of Health. Our Aggie Health and Wellness Center has put front and center on our homepage and our website coronavirus. It has links to communications, frequently asked questions, travel information, prevention, including hand washing, infection control, and links to those agencies for our students. We, too, are encouraging people to call us before they walk through our doors. All of our front desk personnel and our nursing staff have been trained in telephone triage to handle and refer as necessary, or for us to see the ones that we can. We're providing education to committees, classes, students, and patients. We're monitoring and updating our staff daily and our practitioners on any recommendations for coronavirus. And it's business as usual until we're told from the experts something different. Thank you so much for the opportunity to talk.
Thank you, Dr. Bowles. Any questions? Councilor Beta-Studi.
Thank you, Mayor. Thank you, Dr. Volz. My question for you is regarding if quarantines have to happen and you have students on campus that have to be quarantined, what sort of does that look like in thinking of like their basic resources of getting food and that sort of thing? If you could explain a little bit more about that process.
I asked that very question to Department of Health last week, and I said, what if their homes are a dorm? And since then, I've met with the housing director, and we have some freestanding homes that are empty at present and could be and are getting ready for quarantine. We're working with our dining and our food services to make sure that appropriate people, garbed appropriately in PPE, could be able to deliver meals. So hopefully we're planning to quarantine our students on our campus.
Okay, thank you. Thank you, Mayor.
Thank you. Okay, well, thank you very much, Dr. Bowles.
Thank you.
For your presentation. Members of the public have any questions of Dr. Bowles? Okay. Next, Chief?
Yes, Mayor and Council. We also have a representative from Memorial Medical Center, Twyla Anderson. She's an infectious control and would like to say a few words.
Thank you. Good afternoon, everyone. Thank you very much for allowing me to have a few comments. Coronavirus, COVID-19.
Excuse me, ma'am.
Yes.
Can you state your name, please?
Oh, I'm sorry, Twyla Anderson.
Okay, thank you. And
Infection
there's a
control and
little
prevention.
button there, or switch if you want to push it down, if you want to
Okay.
lower the podium so we can see you.
Does that work? I can see you now. All right. Good afternoon. Twyla Anderson, Memorial Medical Center. I'm the infection preventionist there. And so, again, thank you for allowing me a few minutes to speak about the hospital and what we're doing in preparing for COVID-19. As the Department of Health has told you, we don't have any cases in New Mexico, but that doesn't mean that we're not preparing, that we're not drilling, that we're not looking at all of our supplies, talking to our staff, working with our ER providers, because we know the ER is the gateway to our community and also coming in, and if we're going to see a patient, it's likely going to be through our ER. So we have been planning and looking at pandemics and preparing for this for years. And so influenza has always sort of been our target as the pathogen. So COVID-19 is very much like an influenza. If you look at the signs and symptoms, it very much mimics flu. And so what we are able to do at the hospital is to rule out other viruses. So we have a rapid diagnostic test that we can run that looks at 22 different targets, of viruses, and that we can rule that out for that patient. And then we start working, is there a high probability it might be COVID-19? And we are partners with the Department of Health. We work with them. I work with them every single day. We are a surveillance facility for influenza. So I work with the influenza surveillance officer every single year for flu. And so we are monitoring and doing surveillance all the time. And particularly in the winter months, we know that we're going to see a higher influx of patients for all of these viral syndromes. And so we have the surge of patients every winter. And we've had it this winter. And we still have quite a surge of children coming in with these normal viruses that we see each and every winter. And so we're prepared. We have ventilators. We have PPE. The PPE that we have to use is no different than the PPE that we normally use for our patients in isolation. And we have negative pressure rooms. Our facility has 19 negative pressure rooms that we can accommodate. We're actually looking at that we have a wing on our hospital that we can completely quarantine and house up to 48 patients if we had to. And so we're very unique in that way of being able to manage a large influx if we had to. The other thing that we have done very, very well over the years, should we get a COVID or coronavirus vaccine, is we do the boo to the flu. And we do a community-wide influenza vaccine event each and every year. So we call that a point of distribution. And so we know how to get people vaccinated. In 2009, we did that for the H1N1 vaccine. We were the facility, we did, I believe, about 4 different community events. We opened up after hours, we had the public come in, and we know how to give vaccine. So we have those resources, we know how to run those drills, we know how to take care of our staff, we know how to take care of the patients, we have the facilities and the PPE and everything to do that. What questions do you have of me?
Councilor Bencomo, Councilor Flores.
Thank you so much. I'm glad that you mentioned that, it's like a muscle, right, where you practice it. And so I'm glad that you're mentioning that you can be that point of contact for, if and when a vaccine is needed to be given. In terms of that, though, will it be free? Will it be available for free? Will people have to pay for the vaccine?
Sure, in H1, when we had the H1N1, yes, that's when the CDC and the government, they sent us all the supplies, the vaccine, and we gave the vaccine.
That's great. Thank you so much. I'm so glad you're here. You're making me feel better.
Oh, you're welcome.
Let's see, Councilor Flores.
Thank you, Ms. Mary, and thank you, Ms. Anderson. As far as, would you please explain what a negative pressure room is?
It's how we balance the airflow in the room. So if we took the chambers here and made it negative pressure, when we open the doors, the air from the hallway would actually come into this chamber rather than the air flowing outside of this room into the hallway. And so it's how we balance the system, the HVAC systems, to circulate the air. And so in those rooms, we keep the door closed, and when they open the door, the air flows into the room. It's exhausted out through special filters and actually up through the roof and outdoors, but it's filtered. And this is what we use for other pathogens. So for chickenpox, for TB, if we had measles, we would put patients in what we call negative pressure rooms. So that's what, again, we have lots of those rooms, and we are prepared, I think, for any influx that might come our way.
Are those the 48 rooms you mentioned? Are those all
That wing,
negative?
we would make the whole wing negative pressure.
Or you can make the entire wing because
Yes.
of the ducting and the
Yep.
airflow?
It has this independent HVAC system, and so we're testing that right now to make sure we can do that and be able to quarantine.
So you mentioned 48, that you can accommodate 48 patients.
In that one wing.
Okay, thank you.
Yes.
Thank you very much.
You're welcome.
Yeah, I feel a lot better too.
Okay, you're
Thank you.
welcome. Anything else?
Any members of the public? Councilor Ekman, you want to come forward, please?
All right.
He has a question right behind
Okay.
you, so if you don't mind. He has some pretty tough questions, so be
Okay.
prepared.
Good, I shake hands still.
Yes. Good afternoon, I'm Jack Ekman. Mr. Mayor, City Council, administrative staff, I commend our local hospitals on their planning in this area. Hospitals have at least a 30, 40-year history of excellent planning and all of these things, mainly because of the accreditation standards that they are under. And so I believe they are fully prepared. I have more of a comment than a question, and this excellent infection control nurse is not the one it's really directed to. It's directed to the administration of our general hospitals in the city. And it's based on the fact of our workforce. We have a delicate workforce balance in healthcare in the city of Las Cruces. We have nursing shortages, we have physician, primary care provider shortages, we have pharmacy shortages. And if there's any time to take care of our employees and our physician staff, this is it. From what I read, the people who are being affected by this are male and they're senior citizens. And we have quite a few of those in our primary care community. And we should be looking out for their health. Sometimes they just put their head down and they work until they drop. And this is not the time for that, because they could be susceptible to this COVID-19 virus themselves. So as a city council, whatever you can do to encourage our local health community to take care of their own at this special time. No, none of us want this to come into the state of New Mexico or to Las Cruces, but just looking at what's happening around the world, I attended the Arts Festival this weekend, and there were people there from Colorado and Washington and many of the hot areas that now are having that. So that is a daily experience here. We're going to have that around us, and so the possibility exists, but everybody stay calm, wash your hands, and it's going to be just fine. But encourage our healthcare administration. This is a good time to make sure that staff takes care of themselves. Thank you.
Thank you, Councilor.
I can follow up on that just a little bit, because there is a strategy that we use for our healthcare team. So when infectious diseases, or if COVID-19 emerges here, is we do and we will limit the amount of staff that will be interacting with that patient or patients or that wing. We will probably designate a group of us, and I'll be part of that coordination, and that we minimize the exposure to the healthcare team, because we are a precious resource and we want to be able to continue services, be able to take care of the public, but also take care of these individuals with this virus. And so by limiting that and monitoring those healthcare workers, then we can keep operations going on the other part of the hospital. And so that is very important to us. That's why we're going to wear full PPE and do everything we can to minimize any type of exposure to our staff. And so we call it, break the chain of infection. So everything that you see, hand washing, PPE, anything that we can do to break that possibility of transmitting that organism, that's what we need to do. So I just want to commend the grocery stores. For years they've had the wipes for us to wipe down our carts, and we should, always be washing our hands at every opportunity that we can. But again, a virus has to be present for it to be transmitted. And so if we just take care of our hygiene ourselves, get plenty of rest, eat right, and wash our hands, I think we're going to all be okay.
Thank you. We appreciate that.
Thank you.
Yep.
Mayor and Councilor, we'd like to conclude with a few words from our EMS coordinator, Battalion Chief Shane Mouche. But before we get to Shane, there are some other agencies and departments that were invited. They came to show their concern and also to gather as much information as possible. And I want to get back to a question that Councilor Bencomo had answered. I was informed that the Department of Homeland Security does meet on a weekly basis and gathers the information if there's anything going on at the borders, and will get to the appropriate agencies. All right, thanks. And with that, here's Shane.
Good afternoon, Mayor, Council. My name is Shane Mouche. I'm the Battalion Chief of EMS for the Las Cruces Fire Department. I'm here to talk specifically about the Las Cruces Fire Department's response plan. Luckily right now, because there's no confirmed cases, because there's an epidemic going on at the moment, we've had a little bit of time to discuss not only internally, but with our external partners. And that starts with our dispatch entity, MIRVDA. So right now, that plan starts there. It comes to the call takers. Call takers are going to be screening these calls when they, based on the criteria that is set from public health, from CDC, obviously a person traveling out, current flu-like symptoms, those are going to be red flags. Our response, we're trying to re-emphasize to our own personnel, because that information comes across our MDT, to read the notes, to get clear, to get an idea of what that is going to be before we get there. Our normal response based on the apparatus is going to be between 2 and 4 people. So we want to limit how many people. So if it is a high-risk response based on those call notes, we don't want to expose all of our personnel right at once. We want to limit it to 1 person. We have currently right now a decent stock of personal protective equipment, eye protection, gloves, clown, N95 masks. That person certainly would be, we're going to encourage them to keep a 6-foot distance if they can. Obviously, you're going to have to touch that person. So these things are not something that we don't do normally. We're an all-hazard response organization. We do a lot of training all year to treat every response as if it's a danger, whether that be a biological danger or a physical danger. And this is just re-emphasizing those things to our crews. The N95 masks, obviously if you come into a large group of people, you could use them more than once, up to 5 times if the people had no symptoms, but at some point you had to get rid of them. I will tell you right now, we have a good supply. I don't know if I could get any more right now, so we're going to have to be cautious about which calls we use. We couldn't use them on all the calls we go on because we would just use up all the supplies immediately. After the call, the important thing is to really not cross-contaminate. So a lot of what we're trying to do is convince and reemphasize the importance of not only on scene, there isn't a sink generally right there for they can wash their hands, but to quickly decontaminate what they can. Some Cavicide wipes, various cleaning to clean up the equipment and to get back to the station and quickly decontaminate. Washing their hands, whether they had gloves on. Laundering their equipment, their uniform if they have. That is one good thing that we have, is we have facilities to do those things. We have an extra uniform. We have things of that sort at our disposal. Staffing. Right now, we don't have to make any immediate changes. We just finished academy. We're actually pretty well staffed, so we have a little bit of depth. We do have the ability to force hire, call people back if this was to escalate. Right now, there isn't any need of that at the moment. We are encouraging people to, if they are sick though, to call in, to not come to work. We look at it more right now because of the health and age of our responders. They're probably not the type or the category that is at risk to contracting COVID-19 and getting really ill, but we're very concerned about them passing that on to others. So those are some of our concentration efforts. Other than as I said, the normal decontamination of our equipment and our apparatus, those are where our efforts are going to. Call in when you're sick, and documenting when we come back to try and, so at least we can start formulating a paper trail if this does get, so we can know which one of these were actually COVID-19 as opposed to any other of our medical responses. And with that, I'll stand for any questions.
Thank you, Shane. Thank you, Battalion Chief. Questions from council? Members of the public? Okay, thank you.
Mayor.
Yes, I'm sorry. Councilor Bates-Stubbe.
Yes, and this one actually might go to our Department of Health as well. If we do run into supply shortages, would you be able to help assist with that, or how does that work? Yes, for PPEs.
So for our hospitals, we do have what is called coalition cash. And the Bureau of Health Emergency Management is the one responsible for it. So they would let them know, and we would coordinate to see what their needs are. And that's why, as mentioned before, that is why one of the reasons why they constantly have to be sending in their available PPE, the number of beds, because they want to make sure they have all of this into account to go and check their stockpile to make sure that in the event of an outbreak, are we ready to respond?
And that extends then to our EMS or fire, police officers?
We would have to coordinate with anybody that's not part of this coalition would have to coordinate with us so that we could get them to the right track. I believe there are some other ways, but they would have to come through us, and then we would coordinate the efforts.
And so for the city to be able to be part of this conversation, what would that step or process look like then for us?
Well, last week, I believe I sent an email to all of my hospital emergency managers, my emergency managers for each of the counties, and I was requesting some sort of inventory just to make sure where they're standing and how we can assist if there is a shortage. As of now, we have not had any reports. I know that the Bureau of Health Emergency Medicine has supplied for hospitals, and that's why I reached out to my emergency managers, because they are the ones that know my fire, my law enforcement, anything that has to deal with public response, they will be reaching back and will be collecting that information.
Okay, thank you. I think that'll be important to make sure that we continue that conversation, to make sure that our first responders are protected, and then they also see a lot of different patients and our at-risk populations first. So I think it's going to be very important, should we have, a pandemic, that they're protected and they're offering that same protection to the people that they see.
And we will make sure that they will be well taken care of.
Thank you.
Thank you. Okay, thank you, Battalion Chief. We appreciate it.
Thank you.
Mayor, Council, we also have CEO Derek Cuenca would like to say a few words.
Good afternoon. My name is Derek Cuenca. I'm CEO of Mountain View Regional Medical Center. Not quite sure there's much I can add other than to reiterate the state of preparedness that our hospitals stay in. And Mr. Ekman kind of alluded to our credentialing process and our accreditation process. Mountain View has a long history of preparing, as well as every hospital in the country that's accredited, to deal with viruses, measles, including new viruses that come to the table. Ongoing preparation is constantly happening. And we're taking this opportunity not just to, we're sending out internal memos and re-education, not only our staff, but also the medical staff within the entire community in terms of what we're doing as Mountain View and making sure it's getting into those offices, which oftentimes could be the front line to a patient entering the system. With that, we also work with first responders within the city on a regular basis in terms of our drilling process. That way they're part of that drill and they know what's happening within Mountain View as things come up. We've started re-drilling. I think we're drilling almost every day. Also working diligently with the Department of Health and making sure that the communication, as they change or things change, that we're getting that communication not only to our staff, but also to the physicians, nurse practitioners, advanced practitioners that are seeing patients on a daily basis. So, thank you.
Thank you, Derek. Any questions? Members of the public? Okay.
I just want to thank you for sharing that information. It has a calming effect. Thank you.
Thanks, Councilman Forrest.
Chief?
No, Mayor and Council, that was it. Just want to say I appreciate you allowing this work session.
We've got one more. I didn't know if they were going to go before the Colonel. I was going to ask if the Colonel could share a couple.
Oh, absolutely.
Yeah, okay. I'm sorry, Chief. I didn't know. Yeah. Okay, so Colonel Ward, Garrison Commander, White Sands Missile Range, thank you for coming on such a short notice, Colonel. And I know that there's a big event here in the city within a week, and a couple questions as of today. I think it's still moving forward, and then if so, if you could share with the community what safeguards you have in place as well.
Sure. Thank you, Mayor and City Council. Again, I'm Colonel Chris Ward, Garrison Commander, White Sands Missile Range. I'm here to talk about the Bataan Memorial Death March and the mitigations we are putting in place currently in accordance with CDC guidance and guidelines. So right now, our overall assessment today, and this is a very fluid, dynamic, changing situation, but with the facts that we know today, our overall risk to the population, our population being the workforce, our community, both the White Sands community and the community of the surrounding areas, our marchers and volunteers is low at this time. From an operational standpoint, with the additional mitigations we are currently putting in place, we'll be ready and we plan to execute this event. Just let me quickly allow me to explain some of the mitigations that we are working on. Every effort right now is being made to pre-identify people coming from the CDC category level 3 countries, being Iran, South Korea, China, and Italy. We have emailed each marcher that we have, asking them where to confirm their point of origin, or if they've even done any traveling in the last 14 days from one of these 4 countries. We've been pretty successful with this. We identified 2 marchers originating from Italy. We have confirmed with them that they will not be joining us this year for the march. So as of today, right now, we have no marchers coming from a category level 3 country. We are continuing to monitor the registration list. Our registration is still open. As a matter of fact, this morning we had, I think, 26 new registrants just this morning. So the concern you can see, what people have varies from individuals, but right now we still have an active registration and people are still signing up. So we are scrubbing our list.
Excuse me, Colonel, somehow we lost you, but your commanding voice was, we can
I
still
can
hear
pick it
you.
up.
Yeah.
Hello. All right. So we are continually monitoring the registration list and ensuring no new marchers are signing up from one of the Category 3 level countries. Now, there's a thing called Category Level 2 countries. Right now, there's one of those, and that is Japan. I can confirm today, right now, we don't have anyone registered from the country of Japan as we are meeting today. We have notified and we are recommending to participants if they exhibit any flu-like symptoms to follow CDC guidance, and we recommend they do not travel. And bottom line, not only because of the coronavirus and our current environment, but it's a Bataan Memorial Death March. This event is hard enough when you're 100% healthy. So if you're not feeling good and it's not because of coronavirus, we're recommending you go ahead and take it, err on the side of caution and recommend we not travel and execute and participate in our event this year. We're going to continue to distribute health messages on COVID-19. We have flyers and handouts, much like you've heard from the speakers prior to me, that we'll put in each and every marcher bag, and we'll have medical personnel there at the convention center helping us pre-screen and ask everyone. So additionally to trying to get ahead of everyone before they travel, as they come in and pick up the registration packet, they'll be asked one of two questions. One, have you been outside the United States in the last 14 days? Yes or no? Yes, you have. Has one of those countries been one of the 4 countries or whatever number of countries it is by the time we actually start handing out packets starting on Thursday afternoon? Yes or no? Again, if the answer is yes, they have been, we're going to tell them thank you for participating in your interest this year, but we're not going to allow you to march this year. We have 8 medical stations throughout the course that are manned by civilian and military personnel, civilian volunteers, including our medical professionals, both civilian and Army. We have added an additional 108 hand washing stations and sanitizing stations along our course for a total of 124, which is more or less, it is in accordance with OSHA standards. And we have put out and contracted for additional cleaning of our restroom and sanitation type areas. And we also have stepped up our sanitation efforts in our eateries, our bowling alleys, food courts, our club, et cetera, et cetera. We are coordinating with both local hospitals being Memorial Medical Center and the Army Hospital at William Beaumont, both for military, for both facilities are aware and made internal preparations, some of that which you have heard, to respond to suspected cases. Today, as we're speaking, we have what we call a tabletop exercise with our medical team over at White Sands with the Memorial medical team, and what that joint response is going to be and what that's going to look like as we have teammates from Memorial actually at the convention center with us throughout the weekend. And then if we identify someone who's exhibiting signs, symptoms, what our response is going to be and how we handle that patient care from where we locate it to being a civilian to Memorial Hospital or a military personnel to William Beaumont in Fort Bliss, Texas. Bottom line, we encourage each individual and families, you make your own assessments. We've provided information and the facts, and we don't know everyone's personal medical history. So if there's something, whether it's age-related or decreased immunity for various reasons, we're encouraging everyone that's going to plan to be part of our event to make those assessments for themselves and take precautionary measures, whether that's to travel, not to travel, to wear additional supplies, gloves, or handkerchiefs, masks, glasses. There's a lot of good information out there right now on how you as an individual can protect yourself if you have a concern. At this time, is there any questions I can take from the council?
Members of the public? Colonel, you have a question? I want to thank you for always taking my emails. You could tell my concern back and forth, and you've been very forthright and always answering them and sharing with me this information. I can't thank you enough, and this is really good that we have this on video as well, so that members of the public can see your responses, and I think could hopefully take that assessment as to that you all have this. And you said something that made a lot of sense. To do this march, you have to be in pretty good shape, and you probably can't have any problems with your breathing. So,
Absolutely correct.
yeah, so thank you for that. And I joke with you about this, but this is probably, you're looking at a future 4-star general here. This is a great soldier, and really proud to have you in the United States.
I appreciate that, Mr. Mayor.
Armed Forces. Yeah, he's only like 28 years old. He'll probably be general when he's 40.
Sure.
So,
Hey, so I just want to rest assure everyone that, you know, it is planned to go and be executed today. As information changes over the coming days, if something comes onto our radar or guidance changes from the CDC, we will take all of that into account and reassess our decisions all the way up to execution. So this is not a done deal today, and as new information presents itself, but with the information we have, the current assessment is low, and we are planning to mitigate as best we know how with the facts that we have and go forward from there.
I think Councilor Flores had something, no?
I just want to thank you, Colonel Ward, for your service, and your presentation was very upbeat, actually. I mean, thank you for all that energy, and if you put that into defending our country, we're in good hands. Thank you.
Thank you.
Thank you, Colonel.
Yes, sir.
Okay, I guess that's it, Chief. I appreciate you putting this together and getting everyone involved and being able to share with us all these concerns. I think this is a good opportunity for, as I mentioned, those that have some concerns, they can come on, watch the video and hopefully address a lot of their concerns and answers.
No, thank you, Mayor and Council, for allowing this to take place and get the information out to the public. We really appreciate it. And a special thank you to our guests, the Department of Health, and the other speakers. Thank you.
Yes, absolutely. Okay, thank you. Okay, next item is going to be overview of the Mesilla Valley Public Housing Authority, presented by their director, Mr. Juan Olvera. Oh, David, you want to start us off?
Actually, I'm just helping Juan out with loading his presentation.
Yeah. Okay. Good afternoon, Mayor and City Council and City staff. Juan Olvera, I'm the Executive Director of the Mesilla Valley Public Housing Authority. And today I'm just going to give you a quick overview of what is the Housing Authority. The Housing Authority of the City of Las Cruces was created in 1961. There's another housing authority. There was another housing authority, which was the Doña Ana County Housing Authority. In 2012, the two housing authorities merged and created what is now the Mesilla Valley Public Housing Authority. The mission of the Housing Authority is to lead the public effort in providing safe, affordable housing and associated service to provide opportunities to eligible persons in the city of Las Cruces and Doña Ana County. The Housing Authority is governed by a 5-member Board of Commissioners, of which 2 are appointed by the mayor of the city of Las Cruces and the other 2 by the Doña Ana County Commissioners. The 5th member is a resident commissioner, and the resident commissioner is appointed by both the county and the city. They're appointed for a 5-year terms, which are staggered, and they provide service without pay. Currently, Mr. Marcos Montes is the chairman, and he was appointed by the county, and his term expires in 2020. Felix Cordero is the vice chairman and was just reappointed by the mayor early this year, so his term goes until 2025. And we have Mr. Joseph Figueroa, which is a resident commissioner, and his term also expires this year. We have 2 vacant positions, one from the city and one from the county. The one for the city has been vacant since last year. So we need your assistance in finding a commissioner. And one of the things that is critical is because in order to have quorum, right now we only have 3 commissioners. If one of them is not available, we cannot have quorum. So we cannot really take any actions unless we have quorum. The county also has a vacant position. It goes back to 2018, so it's 2 years old. We've been working with the county, also trying to fill this position.
Juan, can I interrupt for just a second?
Sure.
So do we, on the city, they have to live within the city?
The city, they have to live within the city limits. The county, they have to live in the county. They cannot live in the city.
Okay. And do we have like a job description, something that say, perhaps some of us or all of us could put in our social media avenues and advertise it as such? And
yeah, I can provide you with something that I have provided before, but yeah, I'll send you that.
Great.
But the application comes to the city. The application comes to the city. It doesn't come to us.
Okay. Christine says she has it. So
yeah,
she has everything. Great. I'm sorry about that. We'll find you one.
No, that's okay. I know you and I have been talking about this for a long time, but we need the councilors also. They represent their constituents. They could find someone from the constituents. And you'll see later one of the reasons that it's important for the councilors to be involved.
Right.
Thank you. The Housing Authority, currently we have 25 employees. I'm the only employee of the board. The rest of the employees report to me. We have 248 public housing units. We have 40 Section 8 new construction units, which is multifamily. We have 660 tax credit and rental assistance units. We have 1,642 house choice and vouchers. Those include 70 vouchers. We are providing housing for over 6,000 low-income houses in New Mexico. Our annual operating budget is about $9 million. Also, I would like to introduce Ms. Lorena Rivera. She's the Deputy Director.
What was her first name again?
Lorena
Okay.
Rivera. About me, I've been here 5 years, and as a matter of fact, today is my anniversary. Thank you. Previously, I was the Director of Development and Capital Projects for the Housing Authority of the City of El Paso. I basically managed the Capital Fund program, which had about $8 million a year. I developed the Paisano Green Community, which we applied for $15 million. We received $8.5 million from HUD. It was a competitive grant. This community is a net zero community. It's a LEED Platinum certified, no fossil fuels. 73 public housing units. Also apply for the 9% tax credits and basically generate $53 million for affordable housing projects. We did a Hope 6 project, which was also about $55 million, and we developed new public housing units, 317. And also I was responsible for the maintenance of about 6,100 public housing units. I have a master's in engineering and management in industrial engineering from Stanford University, and a bachelor of science in chemical and industrial engineering from the Monterrey Institute of Technology in Monterrey, Mexico. What is low-rent public housing? The Housing Act of 1937 basically created the federal housing program. Then in 1965, the Department of Housing and Urban Development created HUD as a cabinet level agency. There's some other information that I don't want to repeat what is there, but if you have any questions, I'll be happy to answer. Again, this is kind of a little history about the public housing and what has developed. The public housing was reformed in 1998 through what is called the QUARA, and it reduces the concentration of poverty in public housing, protect the access to housing assistance for the poorest families, and is raising the performance standard for public housing. HUD measures our performance. They have what is called the Public Housing Assessment System. So every year, they come and do physical inspection and they measure other indicators. So, and based on that performance, HUD will give us a rating on high performer, standard performer, or trouble performer. We have 4 public housing locations with 248 low-rent public housing. We have Tres Árboles, which has 64 units, multifamily, and was built in 1963. San Pedro, 38 units, elderly disabled, also was built in 1963. Walnut Grove, 99 units, multifamily, built in 1972. And Jardines Alegres with 47 units for the elderly and disabled, built in 1971. As you can see, our stock is old. We need to do something about this. And I will talk later about what is the HUD basically directive. And you can see here their location. You can see that 2 of them are located in District 3. One is located in Council of Incomes, District 4, and one is located in Council of Gander, District 2. Then we have what is the voucher program. This was basically created in 1974. And it has evolved. Initially was like a certificate program, and lately in 1987, it changed to the voucher program. The certificate program was basically phased out by October 2001. So now the only program in place is the Housing Choice Voucher program. So what is the Housing Choice Voucher program? Basically, in a few words, what we do is we provide a voucher to very low-income families, elderly and disabled, so they can go look for housing, but this housing is in the private market. So we have landlords that basically are registered with the housing authority, and the tenants take that voucher that we provide them and go and find a place to live. So what we pay is basically the difference of what the tenant, the individual with the voucher can pay, which is limited to 30% of their income. They cannot pay more than that on rent. So the voucher would pay that difference. So let's say the rent is $500, the tenant can only pay $100 because it's limited. The voucher will pay the difference. In average, we pay $7.7 million a year to the landlords for that rental assistance. And we have over 500 landlords. Of those 1,642 vouchers, we have 70 BASH vouchers. These vouchers are very important because basically it's to serve the homeless veterans. When I started, we had 50 vouchers, so every year we have been able to increase those vouchers. We have to apply to HUD, but we need the support of the VA. The VA that we partner with is the VA for El Paso. So far they have been very responsive. We have 40 family unification vouchers. We have non-elderly disabled. We have 100 vouchers. Currently, we have 13 homeownership vouchers, which basically, when the tenant qualifies, what we pay rental assistance now is a portion of that is used to pay for the mortgage. And the difference is $14.19, which is just regular vouchers. Basic Section 8 new construction is a multifamily program, and they assist housing authority or private landlords. They basically were providing the assistance. Has basically stopped this program since 1983, but the programs that were approved continue to receive the subsidy. Now I'm going to talk about the low-income housing tax credit. This was created by the Tax Reform Act in 1986 of the Section 42 of Internal Revenue Code. HUD was not involved in this. This program is administered by the state finance agencies. In the case of New Mexico, it's the New Mexico Mortgage Finance Authority, also known as MFA. And what it does is reduces the borrowing need and debt for the project. They provide an annual credit, which goes for 10 years. And what the investors do, they receive dollar per dollar credit against their federal tax liability. So the way this works is who applies for the tax credits and gets those credits, then they will go and sell it to a pool of investors. So when you sell those tax credits, the developer, that money is equity, it's not debt. So that's one of the main, I would say, beauties of the program, because you get in equity. So that's why you reduce your debt. Makes the project more affordable in order to serve the low-income and very low-income population. The units that you develop through this program, they have to remain affordable for a minimum of 30 years. These tax credits are awarded annually through a competitive application in accordance with what is called the Qualified Allocation Plan, which is issued by MFA. We are general partner in 8 tax credit development with a total of 600 units. We have 2 properties in Anthony, New Mexico, and we have 4 in Las Cruces. We have Desert Palms, Montana Senior Village 1, Senior 2, it's 5, Robledo Ridge and Stone Mountain, and also we have Falcon Ridge in Hatch. We have 3 affordable housing properties. These properties are non-subsidized. They're owned by the Housing Authority. And basically it's Almendra with 18 units, Oak Street with 22 units. And this Oak Street, basically we have partnered with MESILLA Valley Community of Hope. We provided a community center, office space, etc. So they provide services, and this property has been basically used to house the homeless veterans. And we provide, most of them have our BASH vouchers. And we have the Pecos apartments with 20 units, and I'll talk a little bit more about them in a few minutes. So this is the location of our tax-credit properties and affordable housing properties. We have 3 in Councilor Vasquez, 2 in Councilor Bencomo, and 1 in Councilor Abeyta. So let's talk about Desert Hope Apartments. Desert Hope Apartments is a 9% low-income housing tax credit project. This project started about 2 years ago. Basically, the New Mexico Coalition to End Homelessness developed a training program to develop permanent supported housing. So they contacted Nicole Martinez and invited her to put a team together to participate in this training. So Nicole invited the Housing Authority, Tierra del Sol, and the city to be part of this team. At the end, basically, the team was just the Housing Authority, the Community of Hope, and the City of Las Cruces. The Housing Authority is the one that applied for the tax credit, is the owner of the property, and will develop the property and also manage the property. The Mesilla Valley Community of Hope will be the lead service provider. We will have also a community center with a kitchen and laundry room, offices, etc. The City of Las Cruces has been very supportive on this project. Basically, the mayor and the council have, as mentioned, they're very responsive. They provided home funds and also additional funding to match the local contribution. Also, they're going to waive the impact fees or the permit fees. So it has been very supportive. Desert Hope is located at 3010 Pecos Street, which is District 3. Currently, we have 22 bedroom units. We're going to convert those 22 bedroom units into 40 efficiency units. Additional, as I mentioned, we're going to build a community building with kitchen, laundry room, offices. The estimated development cost is about $6.7 million. We anticipate starting construction in May 2020 and completed a year later. The Housing Authority has allocated 36 project-based vouchers to these 40 units. What it means is that Housing Authority is putting a voucher, but it's not in the tenant, it's in the unit. So those vouchers will stay there. So that's the difference between a tenant-based voucher and a project-based voucher. Those vouchers will stay with the unit, so the rent for the units will be subsidized in order to be able to serve the homeless and the chronically ill homeless. This is just a quick rendering of the last design of the property. So this is the way it's gonna look when we rebuild that. The Housing Authority has a strategic plan and basically has 5 strategic goals. The first one is aligned with our mission, is to be able to provide safe, quality, and affordable housing. We have to manage our core programs and assets to be a high-performing and financially strong agency. Be a leader and a strategic partner with local, statewide, and federal stakeholders to advocate for the development and preservation of affordable housing in our communities. Develop and foster a high-efficient, collaborative, and performing staff that continues to achieve the Housing Authority mission. Improve the lives of our residents by providing opportunities that foster self-sufficiency and by protecting their rights and diversity. What are the current housing needs? The County Affordable Housing Plan basically estimates there's a need of subsidized rental units of 4,300 units. Subsidized senior housing units, 360. The city affordable housing plan estimates a need over 2,000 subsidized rental units. As you can see, 40 units is basically provide 1% of the need. What are the challenges, opportunities that the Housing Authority is facing? Well, the first one is funding. What is the funding that is available in order to develop or acquire housing units? As I mentioned earlier, the 9% low-income tax credits, but it's a very competitive. And the amount per housing project is capped at 1.2 million. Basically, if you receive the 1.2 million over 10 years, that's $12 million. With that amount of tax credits, basically, you can develop 70 to 80 units a year. So we're still very short to meeting our needs. As I mentioned earlier, the city has been very supportive, also the county, and we're looking into other funding like the National Housing Trust Fund, and also the affordable housing program that the Federal Reserve banks have, federal home loan banks have, in order to reduce the gap on our financing and make those units affordable. As I mentioned earlier, HUD is basically directing the housing authorities to reposition public housing. So what does that mean? It basically means that we need to move public housing from, right now, public housing receives funding from Section 9, which is not a stable funding anymore. So they want to have the housing authority switch to a more traditional housing model. But currently, the funding that we receive from HUD for the public housing units, it really doesn't meet the needs. Like we receive, the last few years, we have been receiving $500,000 a year for capital funds. And those capital funds are used to modernize the units, while our needs are over $20 million. So with $500,000 a year, we cannot meet our own needs. And as you saw early, our properties are old. So what HUD is basically telling us, the way you can reposition these units is through what they have, which is called the Rental Assistance Demonstration Program, which is also known as RAD, which you convert to basically a Section 8 multifamily funding. So you will be converting to the voucher program. You can have project-based vouchers, or you can have project rental assistance. They also say, well, you can convert those units to a voluntary conversion. You can dispose or demolish those through what is called a Section 8 demolition disposition. Or we can keep those units, and HUD will basically release the declaration of trust, basically saying, okay, now the units are yours, but you don't get any more subsidies. So it's up to you to maintain those units and cover your operating expenses. Because right now, with the rentals that we collect, the rents are very low. We cannot support our operating costs. So we get from HUD what is called operating subsidy. So the operating subsidy basically covers that gap from the income that we receive and the expenses that we need in order to operate those units. So all that will go away if we just basically say we release those properties to us. So Housing Authority will not have the means to operate those units. And with that, I'll open my presentation to questions.
Thank you, Mr. Olvera. I appreciate your presentation. Are there any questions of the council? Yes, Councilor Bencomo.
Thank you so much for your presentation. I really appreciate it. And for showing us those pretty startling numbers. I do have a couple questions regarding just like general data. And I understand that so it might not be right just the role of the Mesilla Valley Housing Authority to have this, but I'm curious if you do, like the condition of the housing stock in the city, like its age, if it's been restored, right? Like just the condition of the housing stock in the city. Do you have that kind of information?
Not really. I show you what our units are, because
right.
That's the one that, like affordable housing units were built also in the 70s. The newer ones are all of our tax credit properties. When you see they were built in 2000, 2002, up to 2011, which is the last one. But for the city, probably the city staff can answer that question.
Yeah.
Natalie's here.
Mr. Mayor Pro Tem, Councilor Bencomo, Natalie Green with Community Development. We do have those numbers, and we'll work on getting those to you.
That's wonderful. Natalie, what about like the average rent in the city? Like that kind of data?
So our housing needs assessment will have all of that. So it'll
Okay.
have our estimated costs of houses that need to be rehabilitated, what are their conditions. HUD considers 4 major categories of conditions for them to be deficient. Usually that's a lack of plumbing, overcrowding, and lack of working kitchens. So we have data on all of that we can get.
That would be wonderful. And then who does the inspections?
For us, the Housing Authority, HUD will do annual inspections on the public housing units. For the tax credit properties, basically, MFA is a contract agent for HUD in New Mexico. So they have staff that also will do annual inspections. In addition, the investors will also do annual inspections.
Okay.
And there's a standard inspection, and there's scores associated to those inspections. The Housing Authority, the annual inspection score is taken into consideration for all the assessment system. which has other indicators, but annual inspection basically are 40 points out of 100.
And I just want to clarify that there's only an inspection process if there's subsidy tied to that.
Right,
So if
thank
it's a
you.
member of the general public and they're having landlord-tenant issues, we don't have a mechanism to inspect those. So we would need some sort of ordinance or something that gives us property standards to maintain. So if it's not a rehabilitation or a new construction where our community development staff would inspect, then we have no authority to do that.
Thank you for saying that, Natalie. I think that's a really good point.
And Mayor Pro Tem Donovan, Councilor Como, Larry Nichols, Community Development, we do not have a property maintenance code in our city. We do have other codes that would allow us to inspect, but we need to adopt a code of that nature to enable us to help with this inspection effort.
Thank you. I'm really glad you said that. I'm hopefully going to be serving on the Housing Committee, where I think hopefully we'll talk about this, but I would love to see a work session on something like this, like a property maintenance code, where tenants have more say in the conditions of their apartments, their rental spaces. Thank you so much. I think that's it for me. Thank you both.
Councilor Flores. Thank you, Madam Chair. I do have a question for Natalie. Natalie, you said that, Natalie Green. Ms. Green, thank you. So there are only inspections if subsidized. So, and then you clarified and said, well, that's not just a regular landlord-tenant, like a broken window or, plumbing that isn't working. So what do the HUD subsidized inspections entail?
Mayor Pro Tem, Councilor Flores, if there's HUD funding, they have regulations. It used to be called a Housing Quality Standard Assessment. I think now it's the uniform.
So still they're switching, basically they have the Housing Quality Standards, which also, when the tenant has a voucher and goes and finds a place to live, we do an inspection of that unit. We have a third-party inspector that goes into that property, inspect the units in accordance with HUD, Housing Quality Standards. And
so what are those standards, Mr. Olvera? You said HUD.
HQS, Housing Quality Standards, is a very long inspection questionnaire that covers basically health and safety issues, and also the condition of the property. Structure? They look at everything, yeah. They look at the erosion control, see. So it's not only the unit, but also is all the common areas. So if you're looking into an apartment unit, they look at the unit. They look that the kitchen is working, plumbing is working, bathroom, the condition, there is no mold, so they look for deficiencies. And based on that, if the unit doesn't meet those standards, then the tenant cannot move to that unit.
HUD won't subsidize.
Well, we will not allow them to move into the unit because it doesn't meet the standards. We also do an annual inspection.
Who's we?
Housing Authority are basically, we have a third-party certified inspector from HUD. It's not from HUD, it's a third-party inspector certified by HUD, and they do that inspection every year. If they find deficiencies, they identify those deficiencies are being either tenant created or the tenant caused those deficiencies, or are the landlord responsibilities. And based on that, then if they're a landlord, then the landlord has to correct those. They will not pass inspection. They will do a re-inspection until the unit passes.
So is that the motivation for a landlord to bring it up to standard so that they can rent it out?
Well, they have to from the beginning.
Okay, but then there's no standard whatsoever once they move in?
Every year we do another inspection to make sure that the unit continues to meet those standards. If they don't meet those standards, then as I mentioned earlier, then it's determined if those are caused by the tenant or the landlord. Then if they're caused by the landlord has to correct those deficiencies until they pass the inspection. If they don't pass the inspection, we don't pay the rental assistance.
So then the tenant, if the tenant
will
wants to
move.
remain in the property, they have to fix
We
it?
will not approve it.
But they'd be able to stay if they can pay? Or?
Well, they won't be
So
able-
they wouldn't be able to afford it?
They won't be able to afford it.
So then it'd be almost like a self-eviction?
No, we will transfer
Or
them
you
to,
would-
we will transfer them to another unit.
I see. Thank you. Thank you, Ms. Green, and thank you, Mr. Olvera.
Any other questions? Mayor Pro Tem?
Thank you, Mayor. Thank you, Juan. I noticed that I would agree with Councilor Bencomo, the rates and the numbers, the need is staggering. And so you had some slides that depicted what the county's needs are in the city. And in one of them, for the county, you had the subsidized senior housing, but you didn't for the city.
No, because I was just basically focusing on the subsidized rental units. I don't remember if you have that broken down in your plan.
Mr. Mayor, Mayor Pro Tem, Councilor Gondeta, we'll look into that. It's likely in our affordable housing plan, and I just want to point out that this is only the subsidized rental unit. So this is a different number than the number you're used to seeing in our plan, because that's going to cover all affordable housing.
It's over 4,000, which is over 4,000. So this is just
Right.
subsidized.
Right. No, I think I got the numbers down. It's just that I found it odd that you listed the senior, but not for the city, or was it a combination of both? So for me, it was clarification. I think those numbers are really important to me. I know they're important to the city. Our seniors are I often talk about need versus what's our need and what's out there, right? And what it's going to cost. And I'm especially concerned about our seniors, our disabled seniors that really have no other, they're on a fixed income, right? So I want to make sure that we have that number at all times, and that when we start moving towards building that, there's always that emphasis on the seniors for sure. The other, and I was a little confused about the bullet where you talked about HUD and the way it has recommended that we're moving into different funding, not, I'm assuming more flexible rather than traditional funding, right?
Yeah, basically, as I mentioned, public housing is funded through Section 9 of the Housing Act.
Mm-hmm.
And then the Section 8 vouchers and multifamily are funded through Section 8. So Section 9, over the years, that funding is not as available as the Section 8. Basically, HUD cannot, with the funding they receive, they cannot meet the needs of public housing. Remember, public housing was created in 1937. It started as a workforce housing. So a lot of the housing that were built in the nation are very old.
Yeah.
And HUD cannot provide enough funding. As a matter of fact, the proposed budget by President Trump basically eliminates a lot of that funding, eliminates the capital fund program funding, which is the funding that the Housing Authority received in order to rehab or modernize their units. They cut in the operating subsidy. We never receive 100% of the needs. It's basically prorated to about 80%, so they will keep reducing that operating subsidy that we receive. So it makes it really hard to the housing authorities to operate public housing. So that's the reason they want the housing authorities to exit public housing. So that's what they're recommending, moving to the Section 8, which is a more stable funding platform. I say some of the alternatives, the last one, which is basically you keep the units, we'll release them to you, you're the owner. Well, it's not a feasible alternative because we won't be able to sustain and operate those units with the funding that we have, just with the rent. The rent that we collect is minimal.
Yeah. So when it talks about more stable funding, is the only recommendation Section 8 vouchers, or is there other funding out there that we should be made aware of?
Basically, from HUD, it will be Section 8, and it will be either tenant vouchers, project-based voucher, or project rental assistance. Basically, you're converting to public housing to multifamily, which is a different program. It's managed by a different arm of HUD. HUD has a multifamily program and a public and Indian housing program.
So, Juan, in order for, it would be helpful to me to have some sort of slide that talks about the various funding, right, and the amounts, because it could be possible if HUD, if we, the public, said we want our legislators, our federal delegation, to focus their budget or our attention and giving more funding to this particular area, it would be possible. It's just over time they have decreased it to where it is now. Do you know what that total is? And then how does that money go to MFA and then it gets distributed? It goes directly to you?
No, the HUD funding for public housing comes directly to us.
Okay.
Also, all the vouchers, everything, all the funding comes directly to us. MFA doesn't play a role in the funding. For this.
Okay, so what is the total that gets to you?
As I showed earlier, for the vouchers, we get $7.7 million a year to pay for the housing assistance payments. That's the money that we pay the landlords. We also get about $500,000. We get about $700,000 a year to administer those vouchers. Basically, that depends on the number of vouchers that we lease. They pay us to manage those vouchers.
They meaning the federal HUD?
HUD. All funding comes from HUD.
Now, from year to year, has that increased, or the 7.7, or has it decreased?
It has increased because we have increased the vouchers that we lease. So HUD measures, as I said, we have 1,642 vouchers. But basically, HUD measures how much of vouchers are you leasing, or how much money of your HAP you are spending. And based on that, they increase the funding. So they have all these tools that they use to measure. We report every month our expenses, and based on that, they give us the funding.
Okay. And then the last bullet around considering repositioning their units, be it demolish. So you just gave us a slide with how old your units are, right? And what are your recommendations in terms of addressing, rehabbing those? Because eventually we'll need to rehab them.
Yeah, basically, we're looking at each property at itself and the population that we serve. So we're looking probably at the two programs that we're considering is the rental assistance demonstration, which basically will convert the rental assistance demonstration will give us project-based vouchers or project-based rental assistance. So one of the properties we're looking into doing that conversion. But again, in order to do that conversion, we need to find funding because either we're going to have to apply for 9% or 4% tax credit based on what we want to do with that property. Because we can basically go down to the stubs and do a major rehab, get rid of all asbestos and anything else, upgrade to the current codes of the city, plumbing, electrical. So we can do that type of rehab. We can also do a complete
Demolition?
Build new units and add units. If the zoning will let us, we can add additional units. Like let's say in San Pedro, we have 38 units, but we have plenty of space to increase. Also, we can build, right now they're just duplexes. We don't have any apartment units anywhere. So we could add more units. So we can increase densities.
Right, right. So is that what you're recommending to do, or what are you?
That's one of the alternatives. The alternative is that we basically request for a disposition of the units. What it means is, doesn't mean that we're going to demolish and forget about those units. It means that now those units belong to us, but we get what is called tenant protection vouchers for the residents. So with those tenant protection vouchers, basically the residents can pay for their assistance. We can then go ahead and say, okay, we want to, again, go back and rebuild and do add units, increase density. So those are the things that we're looking into.
So do you have, I guess I'm trying to get an idea from you what your plan is with those older units.
Well, right now we're developing a plan. We
Okay.
just did an assessment. We hired a consultant.
Good.
And we just did an assessment, and basically it was presented to the board, and we're going to start, as part of our strategic plan, we're going to start having work sessions to develop that plan for each of the property.
Okay. And so at this point, you don't know what the total cost of any of that
No,
would be?
because it's going to be by property and based on what we decide to do. We want to do substantial rehab, or we just want to take over, convert them to vouchers, or we want to do completely new construction, increase density. So it all depends.
Thank you. Yeah. I appreciate that, and I look forward to hearing more what that need is going to be and the costs and how the city can assist in that process. Lastly, Juan, I appreciate, I had invited you and Lorena over a few weeks ago to speak to some of the issues that I'm having in my neighborhood on the residential side, but also in some of the units there at housing, and I appreciate your willingness to meet with me and to come up with strategies to assist everybody involved and encouraging people to feel safe and in your housing complex. And just so you know, I've had the conversations with public safety, and we're passing on some information about contacts and whatnot, and looking, hopefully, we talked about a block party, right, to
Yes.
involve the not only the residents, but your clientele as well. And I think those are things that are kind of up and coming, so I hope to hear in a month or so what the detail is going to look like, but we will certainly plug you in, both of you in.
No,
So-
as I mentioned earlier, we're eager to participate in this type of activity.
Yes, I appreciate that. Thank you, Juan. Thank you, Mayor.
Councilor Flores?
Thank you, Mr. Mayor, and thank you for all your questions, Madam Mayor Pro Tem. Mr. Olvera, so I'm just curious, so say you assess some of the homes or all of the homes in San Pedro, right there on Mesquite, entre Mesquite y Campo. If the assessment comes in and says that they're very old, there's just too much asbestos, maybe they find mold in them or something that is very, very costly to rectify, and you decide to, or other factors or a multitude of factors where the decision is made to, it's better to raise them all and replace with new housing, and then as you said, there's room there to add more units, or perhaps, because those are like duplexes, little buildings. So what would happen to the tenants at that point? Where would they would have to be relocated?
They will be relocated, but also...
On a long term or short term?
No, it's short term. It will be... It depends, again, on the rehab that we're doing. There will be a short term, or if it's a long term, then they will get tenant protection vouchers if it's longer than 1 year. If it's a 1 year, basically they will be relocated to the units. But one of the things that we're looking is in doing it in phases. Let's say we have 38 units. So we'll start with an area of, let's say, 8 units, and then we'll move those 8 to other units in the same complex. We will basically, we have any vacancies, we will not fill those vacancies to relocate it to those other units. So no, we have to relocate them. We cannot just throw them out to the street, no.
Thank you, Mr. Olvera. Thank you, Mr. Mayor.
Sure. Anyone else? Any questions? So one, and I'm sorry I had to step out for a little bit. So just, and you may have covered this or not, but I know your focus a lot was on low-income housing. How about mixed-use housing? Are you familiar with that? And
yeah, basically basically with that, with tax credits is just one financing alternative to do, but you can develop a property that could have market rate units, they could have tax credit units, which will be affordable. You can have units that have vouchers, and you can have units that have public housing. Like our project Desert Hope will have affordable housing units, which is, we were financed with tax credit. Our eligibility is for 30% AMI, which is extremely low, which is for homeless. And also we have 36 project-based vouchers that will provide that subsidy to those units. So right there you have mixed financing. But yeah, as I comment before in other conversations, in El Paso, we developed a property that we had market rate units in the same complex, public housing units, vouchers, and tax credit units. It's a nightmare to manage because each funding stream has eligibility requirements. In addition, we also use home units because if you get home funds, you tag on home units, so there's another eligibility which is also different. But you can create all those. And basically, that's something that we're looking is, if we're going to increase density, well, that density that the number of units we're going to add are basically could be market rate units or be also project-based voucher units. Also, we could have space for commercial or retail. But it's something that we need to look at for each of the communities.
Well, thank you for that. I like to use the analogy of my Southwest Airlines. A lot of times when you're walking onto the plane, There's people who paid full price, there's some who paid the getaway fare, some have the vouchers for free, and you don't know who. They all have a good seat, and they're all going in the same place. And they can, some can pay some full price, some half price, some free. So I think that's ideally what it should look like. The other thing is, have you ever built mixed-use housing?
Well, yeah, as I mentioned.
I mean, large projects.
Well, we built
And managed them.
The one in El Paso, which was 198 units, and also an additional, there were in place already an additional public housing units. Those public housing units were single-family units. This is a gated community. It has basically a wellness center, swimming pool, basketball courts, walking trails, and you have all these people which you don't know who is who, because some are paying market rent, some are getting the assistance of public housing, they pay $50 rent, but they're all in the swimming pool. They don't know who they are. Yeah, and now basically for that project, we requested, I'm trying to remember, it was like $1.3 million on tax credits. We were awarded those tax credits. So basically it was like 13 million.
Have you ever constructed any? Built them?
I constructed the Paisano Green community, which is a net zero, LEED Platinum.
You yourself? I mean...
well, I was I was the developer for the Housing Authority. I hired a general contractor. I did a competitive bid to hire a general contractor to build that place. The same thing with the other property that I was talking earlier. We hire a general contractor.
So, that's right, you have engineering degrees from Stanford. Stanford?
Mm-hmm.
I don't think I've ever heard of Stanford. No. Yeah, that's great, really impressive. Well, thanks Juan.
Yeah, and then the advantage of that is being the developer, like here in the case that we do in Desert Hope, we are the developer. The developer fees stay with the Housing Authority.
Okay.
Basically, we could get up to 15% of developer fees.
Okay, wow.
And that stays here, and that money will help us finance additional affordable housing units. So that's one of the key.
Well, maybe we might be calling on you sometime.
Anytime.
Okay.
You have my number.
Yeah, okay. Anything else? Members of the public? Thank you very much, Juan, for your presentation. We appreciate it. We appreciate you helping take care of our other members of the community that need that type of housing.
Oh, no, thank you.
Mm-hmm. Okay, so moving on to item number 3. Yeah. Is the Los Cruces Utilities Wastewater Improvements Investment Grade Audit Recommendations. And Dr. Jorge Garcia, Utilities Director, will be discussing.
Thank you, Mr. Mayor and Council. Back in late 2017, we came to you with the very first performance contract with the city. It dealt with advanced metering infrastructure for water and gas utilities. Since then, we've almost completed that project, and we're finalizing the network infrastructure and working on the web portal that will have give access to our customers. So a very successful project. At the end of the project, we will also have a report for both the utility board and the council to show you the savings. The leak detection system has proven very reliable, and we've detected several hundred leaks. We've repaired 100 leaks already in the system that nobody could see. So the technology is there, and the technology is it works, and we're very proud that we adopted that technology. At the time, we informed the council that we would look at water, wastewater, on water conservation and water management measures, and leave the wastewater, which was mainly energy savings measures, for later. So here today, we are on the second part 2 of that investment grade audit, where we looked at the wastewater plants, all of them, and we found some possibilities of savings and improvement in operations. So I'm going to ask Mr. Romine, who you know from Johnson Controls, also introduce one of his regional managers. And after his presentation, we both will answer questions, and I'll explain to council what the next steps would be if you concur with this proposal. With that, Mr. Romine.
Thank you, Dr. Garcia. Good afternoon, Mayor and Council, City staff. My name is Harry Romine, Account Manager with Johnson Controls. With me today is Maureen Blaze. She's our Regional General Manager for the west portion of the United States, including New Mexico. So if you have any tough questions for me after the presentation, I'm going to turn it over to Maureen. So,
did you say her last name was Blaze or Glaze?
Blaze, B-L-A-S-E.
Oh, okay, thanks.
B as in boy.
Mm-hmm.
So I do appreciate the opportunity to provide you an update today on the results of our investment grade audit for the Phase 2 project with the Utilities Department.
Before we begin,
Yes.
just as a reminder to Councilors Bencomo and Tessa Beta Stuvey, this is the gentleman who promised a certain amount of savings, and if not, they'll write us a check. So just a reminder, because I know you've been given a lot of stuff. Okay, go ahead. Just so we can put you into context who you are.
Thank you, Mayor. You always tend to remind everybody about that, so we appreciate that. So just a refresher, the ESPC, it is a procurement vehicle that allows you to make improvements today and pay for those improvements over a term using the savings and the revenues to pay back the improvements. And it's called performance contracting because, as the mayor just mentioned, we have to guarantee those savings. For example, this Phase 2 project, we're guaranteeing about $550,000 a year in savings. And so in year one, a year after the construction is complete, if the actual savings is only about $500,000,
I just talked directly into it.
We have to bring the city a check for $50,000 that year to make up the difference. So it is financially guaranteed. Before I move to talk about the Phase 2, Dr. Garcia covered some of this already. Just a quick update on Phase 1. You can see we are almost 100% complete on this project. It's performing very well. And even though we haven't moved into our guaranteed savings on this yet, we did run some preliminary calculations on the savings during the construction period, and very happy to say that it was just in the increased water and sewer revenues, it was over $500,000 a year so far. This is just during construction from the new meters and the leak detection. So performing very well. Now I'll move into the Phase 2. I'll try to move through these pretty quick. I know it's been kind of a long work session already, but if I go too fast, just stop me, I'll come back. Just a little bit about the audit that we did. We did look at 3 years of operating cost for the wastewater department, and the audit did verify a very good opportunity for some self-funded improvements. We had multiple workshops with the utility staff to review and agree upon, the best solutions. So here are your three wastewater plants. You can see that Jacob Hands is by far the oldest and has the most operating cost. So that is obviously kind of where we found most of the good improvements for the project. SCADA, you might not know what SCADA is, and it's basically industrial controls that utilities use to operate their plants and their distribution systems, which is kind of an industry term. So the utilities has a very well-organized SCADA for their water operations, you know, their pumps and their water wells and their storage tanks. But the bottom line is the utilities has a real urgent need for a new SCADA system for their wastewater operations. I'll talk a little more about that in a minute. Jacob Hand's plant, as I mentioned, this is where most of the opportunity is. We developed an extensive model of this plant because of the size of it, and the model did verify that the plant is actually, even as old as it is performing very good, but it did identify some good opportunities. One of those opportunities is the 2 cogeneration units at the plant. You know, they have already, you know, saved some good operating costs at the plant, but the plant operators actually have to limit the capacity of these 2 units right now because there is not an interconnection for the El Paso electric grid. So I'll talk a little more about that in a second. East Mesa plant is also performing very well. And a few years ago, as most of you are aware, you installed a very large solar PV system at this plant. And congratulations to the city and the staff. It is performing extremely well. It's actually generating over 50% of the power needed at this plant. So that's very good news. And we did find a couple opportunities where we could reduce the cost a little bit more. West Mesa plant, even though it has some old equipment that was relocated from the Jacob Hands plant, the current loads to this plant are very low, and the utility staff instructed us not to include any improvements at this plant right now. One other thing we looked at during the audit is you have some wastewater reclaim water meters. For example, New Mexico State University, you know, they have their own water wells for their water, but then they send all their wastewater to the city. So you obviously have to meter that and bill the university for that. So we looked at the accuracy of these meters. Just this table, we tested 10 of the 20, and you can see out of those 10, about 5 of them, those meters are reading low, so they will need to be replaced. All right, so that's the audit. I'll move into our recommended improvements. I mentioned this already, a new wastewater SCADA system, wireless communication between the 3 plants, and will also be tied into the emergency dispatch center. Over at Jacob Hands, this is one of the larger improvements. You have 4 natural gas-driven gas blowers. These are huge blowers. They're over 20 years old, and they've exceeded their useful life. In fact, one of the 4 is not even operational. The plant is having to steal parts from it to, you know, keep the other 3 going. So there's a real need to replace these with efficient blowers. And then we have a few more improvements that we're doing there. Next one is primary sludge pumping improvements. Again, we're just putting in, this is old, inefficient equipment that we're upgrading. Last at Jacob Hands is the cogeneration plant improvements, which I kind of mentioned earlier. This took quite a while to do, but you know, Johnson Controls and utility staff, we had several meetings with El Paso Electric, and I'm happy to say we negotiated a very favorable rate and deal for the city. One, it will be net metering. So if you do occasionally overproduce from the cogen, then it'll subtract that usage from that monthly bill, just like your solar PV systems do. And the other thing is they're going to allow you to remain on the very low cost power rate. So we were very happy to finally get those negotiations done. This basically will allow you to run both these units full capacity, 24 hours a day, 7 days a week, except when you got to take one down for maintenance, and really utilize the full benefit of these and basically eliminate any more flaring of extra digester gas that you do now. Take that digester gas and use it as fuel for the cogen plant. At the East Mesa plant, just a couple of other improvements there that'll reduce the operating cost of the plant and the 2 lift stations. This is the wastewater reclaim water meters. We will be updating these meters. The other thing is we will be tying these to the AMI meter reading system that we put in for the water meters. So right now these are currently manually read. In fact, there's a few customers that they own the meter and take the readings each month and give it to the utility. So this improvement will take care of all that. A few other little more improvements, lighting improvements at all utility facilities, just upgrade to LED technology. There's also a few air conditioning units we're going to replace, energy management system at a few facilities. Last but not least is EP accounts rate conversion. We studied every electric account that the utility has, and through that analysis we identified, I think it was about 5 or 6 accounts that you can switch to a better rate and save. I think the total savings was about $50,000 a year. So we like to find these because they don't cost anything, and you get a lot of savings. I believe the staff has already instructed El Paso Electric to change these accounts, so you may already be saving some of that money. Okay, so we'll move to the cost.
Excuse me, Mr. Romine?
Yes.
So I don't suppose El Paso Electric is willing to go back a few months of credit since they've been overcharging us?
Mayor, that's a very good question.
Okay.
I will make a note of that, and we have had success in doing that sometimes, in requesting going back a couple of years. It depends on how the tariff is written. It may say that, it's up to the city to tell us you want to switch to this other rate, but it's a very good question, and I'll make a note to look into that, because we have not asked for them to go back a year or two.
Well, it doesn't hurt. Maybe we can
Definitely doesn't hurt.
ask them right before we sue them.
Okay. Use that as part of the negotiations? Huh? Okay, back to the numbers. This is a breakdown of the cost for each ECM. You can see the SCADA and the aeration at Jacob Hands are the 2 larger projects. You've got some construction and engineering costs, and towards the bottom, you have your EMNRD fee, and that is they will do a third-party review of our investment grade audit report, and then they have to provide you a certification of that report, which they are reviewing the report right now. You've got your GRT, which comes to a total of almost $9.4 million. So to look at it from a cost and savings standpoint, you could see that there's about $300,000 electric savings, $25,000 in natural gas. There's some meter accuracy benefits, about $20,000. There is some substantial O&M besides energy savings, so a total of about $540,000 a year in guaranteed savings, which generates a simple payback of about 17.2 years. And I'll emphasize again, if the actual savings is only, $450,000 after year one, we have to write a check to make up the difference on that guaranteed amount. The other thing I'd like to mention is this is the same presentation that we presented to the utility board last month. And since then, we actually have found or identified some additional savings at no additional cost. So the new total savings is about $585,000, which generates a simple payback of about 16.1 years. So that's good news. And that's in the report that EMNRD is reviewing. So from a financing standpoint, again, we generated this before the board meeting last month. In our conversations with your financial advisor, RBC, at the time, he told us to use a 20-year term and 3.5% interest. Well, I think everyone knows that, with the coronavirus and the issues on Wall Street, that the interest rates are probably as low as they have been for a very long time. And in fact, we heard, today that, for a 20-year deal, under 2% is out there. So I think what this says is now is an extremely good time for the city to close on the financing for any of these projects. And the sooner you can move, the better. And so the financial on this would only get a lot better, obviously at a low interest rate. And I think that your financial advisor and, the utilities department will probably consider a shorter term as well, because they'll be able to do that if they want to. Just quickly, you can see that the expected life of everything that we're putting in is 20 years or greater, which you want it to be greater than the term of the contract. Last slide, I promise. So one of the big benefits of the project is it's going to substantially reduce your carbon footprint. These are just some examples of from the CO2 emissions, what's equivalent. You got 548 vehicles a year is the equivalency of the savings out of this project. 297 homes for 1 year. And there's just some other examples there. But just to kind of wrap this up, there's several benefits that we see from this project. One is that the utilities department has, as you know, a lot of capital needs. And so by entering into this performance contract, ESPC, this is taking care of a lot of those infrastructure needs that they have, not all of them, but some of them, and paying for itself so that they can utilize their CIP funds for other projects. The other benefit of this is the current city renewable energy goal that you guys have set, and we're very impressed by those goals. This project will also assist you with that in two ways. One, it's going to lower the electric baseline of the utility department, which automatically your solar PV systems, that percent will go up because we're going to lower the electric baseline. And then two, you're going to eliminate the flaring of the digester gas at Jacob Hands, and convert that to renewable energy through the cogen units. So it has some good benefits there. So with that, I think I'm done, and I'll open it up to any questions anybody has.
Councilor Flores, Councilor Betas-Tubi.
Thank you, Mr. Mayor, and thank you, Mr. Romaine. Or is it Romine? Remind me.
Robine.
Okay, Romain.
It's been said many different ways.
Okay, thank you, Mr. Romain. And as far as, we have page 21, yes, it's probably slide 21 for you as well. We have it at page 21.
Is it that one?
Yes, that's it. So where it says cost, it's $9,366,440. And then it has all the breakdown. Then the last column says total annual project benefits. And then simple payback, 7.2 years. Can you explain all of that to me again?
Yes, Counselor. So what the total project benefits is, the 543 is just adding up the previous 4 columns. It's taken the electric savings, gas, meter accuracy, O&M. So that's the total that we're guaranteeing each year to pay back the project. And so we take the cost, divide it by that total, and that gets you the 17-year simple payback.
So the benefits, the annual benefits are the savings projected per the other. So that last column is what we are saving, and all of that will be recovered. The $9+ million will be recovered at 17.2 years. And if we don't recover annually $543,000+, you pay that back to us? Is that what I heard?
Yes, Counselor, we would pay the difference. If the actual, we'll be monitoring the actual savings each year. And so if it comes in at $500,000 first year, we have to write you a check for the difference, which would be the $43,000 for that year. Okay. And then we'll look at it again in year 2. If we're $60,000 short in year 2, we have to bring a check for $60,000 in the second year. And we come and provide you a report each year on how the project worked each year. Did it over exceed the guaranteed savings or underachieve? And if it underachieved, then we bring a check to that council meeting.
Does that mean that you come back every year for 17.2 years?
Yes, Counselor.
Leave flowers at my graveside. I won't be around.
Yeah.
But my projected actuarial doesn't go that far.
I don't know that I will be here every year for 17 years. I kind of hope not. But the contract does state that we will come back, and we're guaranteeing it every year of the term of the contract. Now, we have had some cities that after about year 6, where we've overachieved the savings every year, they've kind of said, well, I'm good. I feel that we're going to get them every year. I don't need to pay you to go and measure and verify anymore that I'm overachieving my savings. So they have canceled that M&V program, but it's kind of like an insurance policy. You've now canceled our guarantee on those savings each year.
Why would anybody do that? Why would anybody do that? I mean, if you've been paying, okay. All right, no, well.
No, I mean, it's a very good question, Counselor. The reason is that we do have to charge a annual service fee to monitor the actual savings each year on a quarterly basis and make sure that the city hasn't changed the operation of one of the plants, which is causing the energy go up. So there is an annual service agreement that the savings are paying for that too, because it has to by state law, okay? But, so that's the reason that some of the cities have said, well, instead of paying you that $25,000 every year to monitor and come back and verify, that we'll cancel it. We're comfortable that we're getting the savings that we're going to need, to pay back the investment of the project.
I see. Well, thank you. Thank you very much for that explanation, clarification. Thank you, Mr. Romain. Thank you, Mr. Mayor.
Councilor Beta, Stubbe?
Thank you, Mayor. Thank you, Mr. Romaine. While I'm looking in here, you just mentioned a service fee that we would need to pay every year to have everything checked out. Also, when we have these annual projected benefit savings, did you include any other fees that we were going to be paying you as well? How is that included in here? Because that's one area that I'm not seeing.
Yes, Counselor, that's another very good question. So yes, we did. We included, when we look at the O&M cost savings, which is showing here about $197,000 a year, we also look at, well, what are maybe some new costs you're going to have to support some of the new equipment, such as this new SCADA system. So we actually, Dr. Garcia will decide how he really wants to handle taking care of this new server that you're going to need for the SCADA. But we went and got a quote where if he wanted to outsource it to a local company, it was going to cost about $50,000 a year. So actually, we had to back a negative $50,000 to get to the 197. And that's all kind of in the report, where sometimes we had a negative O&M that we had to include in the cost as well.
Okay. And then I guess just to clarify on this, when we have this cost savings, that's also us paying your company for anything that we are obligated to as well. When I'm seeing this number right here, it's also including that fee that you are charging the city.
For us to be monitoring.
To be doing.
That's all part of the measurement and verification program.
Okay.
Yes.
So then our final total savings minus service fee, which we will have to accommodate for yearly, will be that 543, correct?
Yes, Counselor. And,
Okay.
and there is a business cash flow that was not in this, but it is in the IGA report, if you'd like to look at it, and this is what was shared with your financial advisor. And when you look in that, it shows the interest, the total loan payment over the 20 years, and it shows what our M&V cost is.
Okay.
There's a separate column for that as well.
Is the service fee something that is able to be shared with us later on so that we know those actual budget numbers? Or somebody can come back with me.
Mr. Chairman, Councilor, on an annual basis, we will be reporting to the board and then to the council as to what the status of the project is. Mr. Romaine has showed us that we have $543,000 worth of benefits. We've done some of the numbers already with our financial advisor, and the debt service will be about $500,000, $503,000. And the annual measurement verifications in the $26,000. So even at the end of the year, every year, there's some money left over.
Okay.
But the whole point of having the savings is because this money goes to pay for the debt. Now, when I come back to the city council, should you agree with this project, then I come to the city council for issuance of the debt, because only the city council can issue the debt. I will have the financial advisor, RBC Capital Markets, give you a presentation, an independent review of these numbers, like we did last time with the $22 million project. So the financial advisor will show you the debt service, what his projections are, and he'll verify for you some of these numbers.
Okay. Thank you. And Ms. Garcia, we're very confident that should we move through with this, that when we purchase these new equipment areas, since our debt will be, now the 17.2 years, that anything that we purchase will outlive our debt? And if not, is there any sort of guarantees on this equipment?
Mr. Chairman, Councilor Beta, I'll have Mr. Romaine answer the warranty portion of the different parts of the equipment. When we did the water meters were guaranteed for 20 years, and we had a cost for the replacement of the batteries built into the system. So I'll ask him to elaborate on that. But the bottom line is there is responsibility on behalf of Johnson Controls to this project. There's responsibility of city staff to make this project work as well. If city staff doesn't do their job, the audit on the measurement verification is going to tell the utility board and tell the council that staff's not doing their job on their part. Meaning, if we don't replace a part, or the system, the SCADA system failed and it's not working and we didn't fix it, things like that. So it's a contract and has two parties, and both parties need to do their part. Would you like to answer some of the warranty?
See if I can find that. Yeah, Counselor, so this is, you'll see that the expected life is 20 years or greater, and I really think the term of the financing will probably be, maybe end up being around 18 years when it's all said and done with the lower interest rates. Does that answer your question? Or
That's it very close for me, I want to say. 17.2 and 20, I know that it also makes me question if we do see any sort of great technology increases, are we now stuck kind of with what the equipment that we have, and now we have a debt issuance? And so that is a major concern with me. Technology changes so quickly, and in 17 years, I can imagine it being very different than now. And so that's kind of one of my biggest hesitations, I would say, is what happens if we need to adapt for that technology, but we are still kind of locked in these debts?
Yeah, I mean, it's a very good question, Counselor. I think that, at least in my opinion, you know, dealing with wastewater plants and water plants, that they typically hang on to their equipment quite a while, even though there is some new technologies, as you say, do come out all the time. I think what we're putting in is something that would stay for the full, even, you know, these years or even longer. But I understand your concern. We'll be happy to talk to city staff about it a little bit more.
Thank you. Thank you, Mr. Mayor.
Mr. Chairman, Councilor Abetes Tuve, if I can add a little bit. If we were to propose new technology, I would have to come here and justify to you financially that it makes sense to either abandon one of the items on this contract because the savings of the new technology will more than overcome this. As you know, I'm an enterprise fund, so I need to show management and the board and the council that something will pay for itself financially. Adopting technology for the sake of adopting technology is not a good idea. I have to show you that it's going to work financially, and we're going to further save or improve delivery to customers. So again, you can be assured that we need to do analysis and not just say, let's abandon the SCADA system because there's something better in the market. The AMI technology in water meters has been out for some time, and we only adopted it last year. Why? Because, number one, we couldn't afford it. So first we started with a pilot project, and we saw how we were going to implement that over 35,000 customers. And thanks to a performance contract, we found the avenue to do that. But the technology didn't come out last year, and we found for the right time and place to do that.
Thank you.
So, any more questions? Mr. Romine, can you go back to the earlier slide? I think it had 7.2 years. 17. It was just a couple slides before that. One before there. That one right there. So that's based on, can you go back one more? I think you had the interest rate, 3.5, 20 years, 9, right. So this information here, and then if this has to be the interest rate, and then if you go forward to the savings, the 500 and, okay, that one right there. That was based on 3.5% interest?
Well, Mayor, this slide right here, slide 21, this is really kind of year one, you know, at the current cost of power and natural gas. But there is a...
But you included the debt service in there, right? Or
So I did in the cash flow, the business cash flow, that it's not in this slide deck, unfortunately. Probably should have had it. It would have covered some of your questions.
Okay, so let's go back. Go back to the one where it has the 3.5%. What was that representing here, right there?
Yeah.
Is that what, the terms that we're hoping to get?
No, sir. This was like before we did our presentation to the utility board in February, and your advisor said, let's put in a very conservative 3.5%. That's all that is.
Okay, so did you use 3.5%?
I did, and so it still works over a 20-year term.
And so using this, how many years payback is it?
You had to go out about 20 years.
Okay, so how did you get the 17.2?
That's just a simple payback in year one that does not include the interest charges on the loan. It's just a simple, if you paid cash, 9.3 million.
Oh, I see.
Divided by the savings, simple payback.
I gotcha. Okay.
So it didn't include the interest charges or some of the other service costs.
I
So
gotcha.
that, like I said, I wish I'd have had the cash flow
Well, that's
in
okay.
here. I apologize.
I see what you're saying, okay, because I ran the numbers, and if we can get 2% interest, it'll save us about 2 more years.
Yes, sir. It will.
All right, that's what I was just trying to get
I
at.
really think it'll be a, maybe an 18-year term or,
It's an $84,000 a year savings at 2% interest.
wow,
So
that's big.
over a 20-year period, that's 1.6 million. And let me just say this. Usually the technology, sure, there's going to be technology on machinery, but a lot of it is on energy. And so the energy is what drives this machinery. So I still have the air conditioners I use in my office. They're 20 some odd years old. I'm amazed that they still work. But today's equipment will bring it down a little bit better. But if I really wanted to, the ideal thing is solar. That way that, so, because if you have solar and the current equipment still works, just use that. It's free. Yeah. Okay, great. Any questions from members of the public? If there's any public members, I think you're the only one. Debbie? No? Anything else, Dr. Garcia? Or is that...
No, Mr. Chairman, if, of course, this is a work session, so there's no action, but the next steps, if the council feels comfortable, by the way, the utility board did recommend this project. The next step is we go back to the utility board with the overall investment grade audit contract, which is a state contract. The utility board cannot issue debt, so they would approve the contract and send it back to you for financing. When I come back for financing, we will have a presentation from the financial advisor, and we will look at the terms of the loan, most likely, given the size of this loan, and I will need approximately $13 million for the next couple of years for other improvements. So most likely we'll issue about $22 million worth of bonds, most likely through 2 NMFA loans. That's the thinking today. Now, I haven't talked to the financial advisor this morning, so I don't know, things may change. But so we will come to you with a whole package. One will be the guaranteed savings contract. That's probably one loan, and the other loan is for the capital improvement plan. And at that time, you'll be able to ask questions. Like I say, it's an independent review by the financial advisor of these numbers you've seen today. So at that time, you will have a first read and then the second read and move forward with the financing. We will try to move as fast as possible because interest rates are really low, as you know, from the last two, our refunding. And so I'm trying to move as fast as possible. I'm trying to go to the utility board next month and then come to you on a first read also next month.
Yeah, you don't think you can call a special meeting of the utility board?
I could, if Mayor, if we have to, we will. I think I'm trying to do simultaneously almost your first read and the board approval, and that happens early in the month. So we can get out next month and get on the NMFA list, then we will be okay.
Okay. All right.
Thank you, Mayor and Council.
Okay. Thank you, Dr. Garcia. Thank you, Mr. Romine and Ms. Blaze. Okay, it looks like the last item, Las Cruces Economic Outlook Update, presented by Dr. Francisco Pallares. I wonder if we should teach a few classes here at night with so many PhDs. We can just offer some college courses, bring in some extra money. Huh?
Get a city discount, right? Good afternoon, Mr. Mayor. Good afternoon, City Council. My name is Francisco Pallares with the Economic Development Department, If this is your first out of the two yearly updates on the economy of Las Cruces. Before we proceed, I just wanted to show for the new counselors how to get to the report that I produce on a quarterly basis. So you just simply open your search engine of preference and you can type City of Las Cruces Economic Development. And the first one right there should take you to our city page, to our department page, and it's just scroll down. There's a little button that says Economic Outlook and Report, and from there it says Economic Outlook Quarterly Report. So we have all the different outlooks we've produced since the first quarter of 2018. The latest one is this one. It's a 42-page document. I typically publish this and during the month of the in which the new quarter begins. So this one speaks of the fourth quarter of 2019, and it has a lot of information in there. So it has information with cumulative growth and unemployment rates and a lot of different things. So you're able to access that. That is already currently in our website. Actually, the presentation that I have for today is mostly based in numbers from that specific report. So with that said, again, thank you very much for the time of allowing me to speak here today. The first thing that I will show you is the labor market. The panel on your left shows you the unemployment rate by month that we have seen in the city of Las Cruces for 2019 and 2018. As you can see, the numbers are pretty resembling of 2018 figures. We have pretty much behaved the same for the last 2 years now in terms of unemployment. The unemployment is, compared to the state of New Mexico, it's still a little higher compared to the state of New Mexico, but not by much. We're still somewhat far away from the United States unemployment rate. If we take, for example, December's, which is the preliminary figure for 2019, we had a 4.7 unemployment rate, whereas the state of New Mexico had 4.5, and the United States showed a 3.4% unemployment rate. So the important thing to figure from here is to see that we're not that far away. We've been consistently behaving like we had since 2018, and it's not that high of an unemployment rate. And it's interesting because, as I will say towards the end of the presentation, we have seen some increases in the number of people that are employed and some increases in the number of people that are unemployed. And there's a reason for that, but we'll get to that as we continue to move forward. The next one, it's a slide that I usually show in front of you that tells you what are the top employment industries in the city. The panel on the left shows you the top 10 industries by employment in the third quarter of 2019. The biggest employer, of course, are elementary and secondary schools. Then we have our restaurant businesses, which employ collectively about 5,000 people. Then we have 4 different industries, all dedicated to healthcare, between general medical, home healthcare, offices of physicians, services for the elderly. Then we have a big chunk in police protection. We have contact centers such as telemarketing, as well as warehouse clubs and supercenters. Just to point out, these 10 industries collectively employ right around 18,000 people in the city. So you are very likely to know someone that is employed in one of those industries. I mean, very, very likely that you know someone at least that is employed in one of those industries. So with that said, the panel on your right shows you which have been the biggest increases quarter to quarter from 2018 to 2019, the third quarter. And the biggest jump that we could tell from there is educational services. So educational services grew by 232 jobs. And one important aspect that I want you to see is that heavy and civil engineering construction had also a big jump. Professional, scientific, and technical services had also a big jump. This is your engineers, your accountants, your lawyers, your all combination of the above. We got some growth in retail, slight but small, but still a growth in gasoline stations, some growth in food manufacturing, as well as some of the others. Now, this is for the metropolitan statistical area, which again, this pretty much encompasses the overall Doña Ana County. And the panel on your left is the total non-farm payroll employment that we have seen every month. On each one of those months, the blue line has been, which is 2018, below the green line, which is 2019. So that speaks, of course, of a good labor market. We've been adding jobs consistently, at least compared to 2018, except for the month of September, in which it was slightly below, but nothing that you could tell was a big difference. Now, when we look at this December to December, year-to-year change in total non-farm payroll employment, you can see that the green lines represent industries in which we have experienced growth. If there is no change in those, then it means that it stays pretty much the same. And for those red bars, it represents a decrease in total non-farm payroll employment. Again, this is for the metropolitan area, which is pretty much the overall Doña Ana County. Now, what are some of the key aspects that we're observing? Home median listing prices have been increasing, and they have been increasing by some bit. If we look at the panel on the left, we have the home median listing prices of homes in the city of Las Cruces as it is reported by some websites such as Zillow, Realtor.com, and Trulia.com. By the way, the reason why you don't see Trulia going all the way is because they got acquired by Zillow. So now they don't have two research departments at the same time. So they just consolidated all one in Zillow. So we can say goodbye to Trulia now. So the important aspect here that I want you to notice, and I don't know if you can see the arrow here, right here in January 2018, right around about 195,000 median listing home prices. Fast forward 24 months to December 2019, and we're kind of observing 215,000. That is, in a period of 24 months, we saw an appreciation, at least in what we can see in the median listing prices, which sometimes people go the higher bid, right? But it still reflects an upward tendency of about $20,000 in these 24 months. Just to see whether we were doing the right thing, and this was the right tendency, I looked at the all transactions index data, which is estimated using sales prices plus appraisal from the U.S. Federal Housing Finance Agency, and we found the same tendency. Now, this one over here is an index, so it represents, the movement represents a general movement, but you can see the upward tendency in this index as well. How are we doing in terms of not only the price, but the supply, the units? So the panel on your left shows you by breakdown of new single-family residential or multifamily. The darker green represents multifamily. But then the panel on your right is actually quite interesting. The green line, represents the 2019 figures as were collected by the Community Development Department of the City of Las Cruces. These are single-family new residential permits. And as you can see, not only that, the green line, but I think maybe you see it as orangey, reddish line, represents 2018 figures. If you look at the 2018 figures surpassed their averages from 2010 to 2018 in pretty much, in most cases. So since 2018, we've been adding more units. And then in 2019, we have also continued to add more units to the housing stock of Las Cruces. Now, how much more or how many more? If we measure it just as the number of permits, in 2019, there were close to 581 of those, and for 2018, it was 511, compared to 2017 of 470. So we keep seeing this increase, and it is not only reflected in the number of permits, it is reflected in the median housing prices, and it is also reflected in the data of the growth in construction. So we're seeing a pretty strong construction sector, at least in this 2019. Now, what about businesses or business registrations, the way in which we trace them back using the City of Las Cruces Community Development traces back? Your panel on your right uses the averages from 2010 to 2018. And my deep apologies, but I forgot to put the 2018 figures in there. So when we put the 2018 figures in there, we have seen that it has actually plateaued. So we have seen that they have leveled off in terms of the new business registrations. So what we were able to see is that in 2018, there were 586 new business registrations, whereas in 2019, there were 530. So it was a decrease, but not that substantiated. Then the next one is business renewals. And the renewal of your business license, of course, this has also the image right here on your left represents kind of a plateau, and the same occurs right here. The panel on your right also shows, and I have the data right here, business registrations in 2018 were about 2,451, whereas in 2019, they were 2,304. So again, the tendency that we had from back in 2017, that was a substantial decrease, it has at least leveled off. It is no longer that steep of a decrease. So again, this is reflected in the strong labor market we have observed, as well as some of the things that have been showed in the other data. What about retail? How is our retail sector doing? The panel on the left shows you in nominal terms, just in current dollars, how our retail sector has been behaving, and it's actually kind of flat. It hasn't increased by much, but it hasn't decreased by much either. So it has sustained itself. If we adjusted for inflation, the panel on your right actually traces real retail trade by tracing the gross receipts that we've been able to see. You can see that we have behaved just right around the average. So our retail sector isn't growing by much, but it's not decreasing by much either. So this is what we can get from the perspective of retail and the consumer in the city. What about the investments that we have created in terms of commercial real estate? Now, the panel on the left, I inputted a regression line, that dotted line right there, but there's a lot of variability, as you can see on the panel on the left, correct? So when we look at this compared to the average valuation per new non-residential commercial permit, you can see that we had two big spikes because of the construction of the hospital and the construction of the medical offices. But then it just started, in some instances we were above, in some instances below, but it just started leveling off as the year continued to pass by. In terms of cost of living, the data that we collect from the Council for Community and Economic Research, that we support them in doing the analysis for the cost of living, the panel on your left shows you the black line, which represents the US city average. So if we are below that, that means that we are, so for instance, the composite index is the overall index, which shows you that we're 88.3 compared to 100 being the US city average. So we're relatively about 11% cheaper, well, not cheaper, least expensive or more affordable here in Las Cruces compared to the average US city. In terms of groceries, we exceed the national average in terms of that. So our groceries are more expensive, but our housing is substantially much more competitive. We're right in there for transportation, right in there for healthcare, and other miscellaneous goods and services are also below. So the only instance in which we have overperformed the US city average is in terms of groceries. The panel on your right here is us comparing to ourselves. So us in 2018 and us in 2019. So the way in which I calculate this is that we look at the ranking, the index that was provided for us in that specific quarter, and how does it measure with the change in the current quarter. So we saw some decreases in miscellaneous goods and healthcare, and there was a slight increase in transportation costs, as well as decreases in utilities, housing, groceries, and the overall composite index. Now, this is good news. We finally have data for downtown. Remember that at some point, the SUFA benches were no longer providing the service of how we could track the number of visitors in downtown. We can track it back again. Now, it is, and thanks to the IT department that supported us in this effort, to be able to get a signal, it's actually no longer tracing the benches, but now tracing the plaza. So these are mostly plaza visits by month. The panel on your left, you can see that the orange or reddish, whatever the color it is, represents repeat visits on that specific month, and the green ones represent new visits in that specific month. The blue line right there represents the total visits that we had in that specific month, and then the panel on your right tells a much different story. The panel on your right, I basically break it down by day of the week. And on that month, what was the highest concentration of visitors in that specific day of the week? So you can see immediately that the green line is pretty big, right? That is your farmer's market, your people going to I don't know, going to one of the breweries or just hanging out in downtown on a Saturday. The blue lines, the sky blue color represents your Fridays. So Fridays took a smaller share of the week in October and also on December. But from here, you can start seeing certain patterns that are interesting to observe. Now, the next one. This is a special commendation for Madam Mayor Pro Tem, who requested having some information, having some way of tracing vulnerable populations. So Madam Mayor Pro Tem suggested, can we add something that helps us assess a way in which we can be tracking kind of constantly how our vulnerable populations doing? And the thing is that for information of that nature, the closest one would be the U.S. Census. And the U.S. Census only publishes American Community Survey publishes every year. So in order to try to get to that and having it in more frequency, I looked at the SNAP cases in Doña Ana County. So as you can see, and in this case, of course, we want to be low. The lower, the better in this case. So the panel on your left tells you the SNAP cases by the sum of the 3 Doña Ana administrative offices, and this is in thousands. The blue line represents your 2018 figures, whereas the green line represents your 2019 figures. And the green lines were, in all the cases, below their 2018 counterparts. So some efforts being performed from that. If we look at the past 12 months, you can see that the tendency is very, very slight. It has kind of plateaued, but you can see that there is a tendency right there. With that said, what do we have ahead of us? So the first slide, we started with the labor market. And the interesting thing here is that we were very, very close to 2018. So on average, 45,000 people were employed in 2019, which is above the 2018 figures with 44,000. So that's a difference of about 900 more people responded to be employed in 2019. Interestingly enough, 2,416 people responded to be unemployed on average in 2019, which is above what we experienced in 2018. So we had more people employed and more people unemployed. How is this possible? We call that the discouraged worker effect. That means that when people see that there's a better outcome in the labor market, that people are hiring, they leave. They were not previously on the labor force, and they join the labor force to start looking actively for employment. So what that does is that if someone was discouraged because the labor market before was not that good, now that the labor market has improved, they start actively seeking for a job. So whenever the survey comes, they say, I'm unemployed. So that adds to the number of unemployed people. So we have seen some of that discouraged worker joining the labor force due to the improvement in the labor markets. Just as an example, when I did a quick search from New Mexico Workforce Solutions, just this March, well, not this March, we're still in March, but this, about 4 days ago, I did a search and 438 job openings when you just list Las Cruces and you just put a radius of, I think it was 50 miles, but when you reduce that to about 25 miles, it's still about 400 job openings that are active in their website. What are some of the things to look ahead? There is importance to look at what is going to happen with the macroeconomy. The Fed just cut the rates from 1.75 to 1.25 about 6 days ago. And this is amid fear of coronavirus effect. So the coronavirus is expected not only to disrupt, which already has, some supply chains because of factories in China that they had to close, and now you have to get that specific one, specific product from elsewhere. But it could also affect us not only from the supply, but also from the demand side. It is no news to you that a lot of people have canceled conventions. Those are dollars that are not going to go into a specific economy. The most famous case is South by Southwest was canceled. People are not taking trips. As Councilor Flores mentioned, flights are pretty cheap right now. So the fear that you could get infected, preventing people from actually going and spending, is what could be affecting us from the demand side. So we have to keep an eye out for this, because we're currently, fairly recently since this happened, the outbreak was kind of famous in February, and then it's starting to see it in March. So we will not be able to track this until summer, once more data becomes available. So we will actually be able to see, oh, this is what happened, and this is the effect that the coronavirus could have had. Not only that, but here in Las Cruces, we have experienced lagged periods whenever there's well, not always, but in instances in which we had recessions, we had a lag period. It didn't affect us immediately like other cities. So we could see a repercussion at some point. But this is just something to have in mind. So just some of the things moving ahead. As of right now, of course, for our city, the labor market is strong. Questions?
Thank you, Doctor. Questions? Councilor Bencomo?
Thank you, Mayor. Thank you, Dr. Payares. I am so infinitely grateful that we have someone like you at the city, not only because you're brilliant, but because you're excited to talk about numbers and where my anxiety starts going this way. So, but thank you for that presentation. That was incredible. I have a couple questions. The retail information, is that sort of normal across the country? And why?
Mr. Mayor and Councilor Bencomo, the retail, it's not always normal elsewhere, but it's relatively common in a border area that is a subset of a larger metro area. So not only consumers from El Paso come here, a lot of consumers from us, we go over there, but we are also kind of the hub for southern New Mexico, right? So we do get some retail trade from that perspective, but for us, it's pretty leveled, but there's a lot of regions in the U.S. in which that graph is actually going down.
Okay, interesting.
Yes.
The cost of living graphic, the one on my right side, can you sort of just help me understand what that means for people?
For people, it will be basically comparing when we did the analysis back in the third quarter of 2018 to the third quarter in 2019. Let's say, for instance, in healthcare, some of the information that gets collected in that has to do with the cost of a doctor's visit, of an optometrician, of a dentist, and the cost of, I think, Lantus, Solostar, which is for the treatment of diabetes, and Advil. So those reflect the overall movement that go into making that one. So in essence, the 6% decrease basically says that somewhere when we trace the prices around that, for the next year, it represented a 6% decrease in those
Like
prices.
for me as a consumer, it represented a
consumer.
6% decrease in my healthcare costs.
And as it is measured by the things that go into building that, correct?
What about the transportation? Does that include like the cost of cars, gas, that kind of stuff?
It includes cost of cars, and it includes the alignment, for wheel alignment.
Oh, sure, maintenance.
The maintenance and several, I think it's at least another one that I cannot remember right now, but it reflects an overall change in a specific basket, if you want to call it, of goods and services in transportation.
Okay, cool. And then in terms of wages, do you have data on that? Like, are wages generally on an up scale, on a downhill?
So for wages, we do trace them, but we trace them by industry. So different industries have different changes, but the overall one is on the bigger report. So in the bigger report, it's actually 42 pages, and that one you can go and look for that one, but we do have information on wages, yes.
Okay, cool. And then I think I just have, well, so I'm a people person, you're a number person, I'm a people person. You could be a people person too, I don't know. When you say 44.7 unemployment rate, I automatically think, who are those people in our community, right? Like that's where my head sort of goes to. Do we know, like, are these folks sort of like, is there chronic unemployment? Is there some sort of transition in industry? Like what's happening that these 4.7% of people in Las Cruces are unemployed? Does that make sense?
Yes, Mr. Mayor, Councilor Bencomo, that information is also part of the report. So we break it down by level of education, by, what can I remember?
That's in the report that you showed us how to get to?
How to get to, correct. Now, with one caveat, the latest information to go that deep into actually pointing out who is that specific, well, not that specific person, but that group is only produced on an annual basis. So this more higher frequency data is aggregated so that it can be reflective of an overall movement. But once we start dealing with a more specific topic, that is not as frequent as in a monthly basis, for instance, as I reported here, but it is reported for 2018 at least from the census.
Okay, thank you. And then the last thing I'll say, because you brought up coronavirus and we've been talking about that all afternoon, I do wonder how that's going to affect employment and unemployment, given that a lot of industries don't have paid sick leave policies across the country, right? And when I think about particularly the restaurant industry and how many folks, if they're taking time off because they're sick, and they should be, how that'll affect unemployment rates this year.
Coronavirus is certainly no good news, Councilor.
Right.
I guess for the hand sanitizing industry, maybe.
Right.
And for Lysol and for very, very specific, it might be good news, but for the overall economy, it is not.
Yeah.
It will prevent people from travel. It will prevent people from spending. It will prevent people from going out and having fun and going to dinner and.
Yeah. All right. Thank you so much, Dr. Payares. That's it. That's all of my questions.
Councilor Beta-Stuvi.
Thank you, Mary. Thank you, Doctor. Kind of along the lines, do we track other industries that affect our area? I know one of the big things we talk about is when we have the oil boom in Carlsbad and stuff, we're seeing a lot of our skilled labor leave for these other areas. Do we track that, and do we have any expectations now that we might be seeing differences in oil prices and things on how that might affect our community?
Mr. Mayor, Councilor Beta-Stuvi, the information on migration and domestic migration, I do not track it. There are resources out there that we could technically look at, but seeing where is someone in a specific industry coming from going to work for might be a little difficult. In other words, I know the IRS traces the number of times that the people move from one place to another one, and you can trace in or out migration like that on an annual basis. But whether that person became a nurse or that person started working in some other field, that I am not sure.
Okay, thank you. And thank you for all this information. I already have pulled up the 42-page report, and I'm finding it fascinating. So I may be coming back to you all later with more questions once I review all of this. But thank you very much for everything.
Mayor Pro Tem and then Councilor Flores.
Thank you, Mayor. Thank you, Dr. Baez, for your presentation and all your work. Always appreciate that. I am interested in slide 5 around growth and construction, and my question was, do we know more the homes that are being built in what price range they are?
For the homes that are being built? That is a good question, Councilor. I am not sure whether perhaps Tim might have something from. But let me put it like this. The new permits, of course, would have to provide for a brand-new house.
Yeah.
And we typically trace that by the average valuation. Now, the fact whether or not they're going to sell it at that valuation might be a little different, but the overall tendency that we can truly observe is that home median prices, it can be new, it can be used, correct? From Trulia and from Realtor, they can be sold at a specific, and actually Larry Nichols from Community Development might know the answer to your question, okay?
Might know. Very good.
Good afternoon, Larry Nichols, Community Development. Right now, we're seeing the home prices, the cost of the home itself is about $230,000 average. The lot price is about $50,000, so combined price about $285,000. One of the things that we do notice is that we don't have many of our contractors, our residential contractors, interested in building affordable housing. They have a market that they're selling about 600 homes a year right now in the market that they're addressing, and those homes are selling. But we seldom see affordable housing, particularly mixed type of housing, apartment house, quadplex, triplex, those type of projects. We seldom get a permit request for those.
That's a bummer, huh? Unfortunate. Since you brought up affordable housing and not having the number of permits for all the various types that you just mentioned, I had made mention to Mr. Dollahan that in September they're doing an affordable housing conference in Albuquerque, I believe, and typically they have these opportunities for all construction folks that are interested in affordable housing up there. So I wondered if we could do like a pre and or a post sort of where we encourage them to come down here and see what that looks like, and really looking at, based on the information we got earlier with Juan and Natalie Green, and what our need is, if we can get some excitement about building around the price ranges that we need, because I feel we're desperate to and when you look at what the price is, that's kind of unreachable for many of our families, particularly our middle class. And so I thought that might be, I found it a nice thing to add to your all the things that you do. So I'd love to see that is either a pre or post to really encourage, because I think what I was told from by Ms. Martinez, that they have those opportunities there. Many of them go and they set up their tables and whatnot to encourage that and sort of the relationship building, engaging, right? But also it would behoove us. I feel like we need to have more activity around there to really hear from construction developers what that might look like.
And Mayor and Council Pro Tem Gondarelle, we're going to find that as the Housing Policy Committee is reactivated, I think those are some subjects that we can address before that committee.
Well, I don't know when those PRCs are going to be up and running, but I'm hoping that that we can start working on that particular piece. I don't know, Mr. Dillon had his light on, so I don't know if he's been working on it or not.
Mr. Mayor, Mayor Pro Tem, if I may, we're working on a organizing group, a very preliminary one, and then we'll follow up. I think it's sometime between now and the end of the month.
Thank you. And on page 7, Dr. Valleras, I had some questions about the business renewals. And last time when you brought this up, we had some concerns about the programming, the difficulty that people were having. I believe that Councilor Vasquez did bring up some of the issues specifically around renewals and whatnot, and still seeing some of that struggle with doing some of that. So I'm assuming that, I guess I wanted to see if there was any new developments or changes to the process. And if there are still problems, might we have seen some of the decrease in renewals because of that?
Mr. Mayor, Madam Mayor Pro Tem, I'll probably let Tim Pitts answer that question, ma'am. However, very, very quickly, just for context, in 2017, the number of business renewals was about 3,504, which compared to 2018, it saw a substantial drop of about, it was 2,451, so a drop of about 1,000. That's 2017 to 2018. However, 2018 to 2019, it has leveled off. So in 2018, it was 2,451, whereas in 2019, it was 2,304. Mm-hmm. So it's still negative, but it's the second derivative, right? The next one is at a decreasing rate. So it has leveled off. But Tim?
Tim Pitts from Community Development Department, Mr. Mayor, Mayor Pro Tem. As you know, last time we did talk a little bit about how the movement to a new software caused some issues, and you'll see it in the numbers a little bit. The early months of 2019 had some lower. It took us a while to work through how many new people were processing their renewals. So the renewals aren't really quite in the right months always in the data. Because it just took us some time to get them through. But you'll notice they do level off, and we have found that as people have gotten through the change, it's not as difficult for them. So I think we're pretty stable right now. I'm not hearing a lot of complaints, and if you are hearing them, please send them to me, and I want to get them fixed. But we did a lot of work over the last 6 months of last year to make sure that people had an easy way of getting registered. And I think most of them find it to be an easier process now. So I think what we are doing right now is we've gone back to older data and have looked to see how many of these businesses that we were reporting on actually had been closed for a couple of years, and there were some of them. We didn't have a good way of closing them out. So we'd have to go and do investigations. And well, if you have a home-based business and you're doing an investigation of whether they're still open, it's hard to tell. And what I think is happening with a lot of the home-based businesses, it may actually be a good thing. Francisco talked about the unemployment rate. I think a lot of those people had started businesses that maybe were semi-viable businesses in their home, and then when they got a job, they stopped doing it, and so they stopped registering their home-based business because they got a real job, and now they're getting paid. And well, I'm not going to sell stuff on eBay if I can go to work and get a paycheck. So I think there's a little bit of that, but some of it we just don't know. We don't know what. And we think a lot of the volatility came out of the home-based business sector, and we just don't. It's a hard industry to figure out what people are doing. Since we don't inspect them, we don't talk to them. If they don't come in and register, we'll send them something, but we don't want to bother them at home. That's not the goal. In terms of, and I think you did mention this in the presentation, in terms of the brick and mortar businesses out there, they have been very, very stable. We have businesses in business centers, in retail centers, and so on, have been very stable. Now, there's a lot of volatility. A lot of businesses open and close, restaurants open and close, but you'll find, you look around in the community, a lot of those retail stores, a lot of those places have activity in them. They are continuing to be successful. Just by the way, I happen to be talking to the mall manager. He's saying he's well over 80% full, and that he has somebody for Sears, but he can't tell us who that is yet. So the mall remains a viable business. So just a couple of pieces of information.
Great. I appreciate the dialogue around the home base, the entrepreneurs, I guess I would put it. And so are there recommendations to be able to track those more thoroughly? Because if I remember correctly, Dr. Paredes, you did the reporting about those 3 sectors that we should really keep our eye on, and entrepreneurs is one of them, medical was another, and aerospace was the third, I thought. And so if there's something as policymakers that we need to do to establish, some sort of policy to ensure that we're collecting that data better, we should know that. So is there any recommendations around that?
Mr. Mayor, Madam Mayor Pro Tem, the answer, what you're referring to was more specific to the West Mesa Industrial Park. But yes, we were trying to figure out what were some of the niches that industry would fit in the specific West Mesa Industrial Park. But in terms of the data collection, actually the Community Development Department has been implementing a brand new effort in tracing which ones are home-based and which ones are brick and mortar. I think the data goes, was just recently adopted, was in June 2018, June 2019. So it is fairly new. We need a little bit more time so we have more observations.
Good.
But the implementation is now in there.
Great.
We can now see, and in the future, once we have 1 year's worth of data, we can now actually see these have been home ocs, these have been brick and mortars.
So on slide 11, I find that really fascinating, particularly in the increase of groceries that were higher of other national, of the national, I guess, rates, right? Especially because there's such a high increase of people, food insecurity, right? And that we're an agricultural community. So it feels like, I don't know, it feels really concerning to me. And I don't understand why that is.
Mr. Mayor, Madam Mayor Pro Tem, precisely to answer that question, because I was asking myself that, was that I went out and started looking for some information that could be out there. What I found was a report created by the Institute for Local Self-Reliance. And what they mentioned is that our town is seen as a Walmart-dominated city. So in other words, that the share of the market that belongs to a specific grocer is about 57%, as to their estimates, correct? I'm not endorsing their estimates, but they mentioned that it was about 57%. So if it's dominated by a specific player, it discourages other players because they would be fighting close to a smaller share of the market. So that prevents other groceries from coming in. So the report, and actually we're not as bad as some other places, which Portales, I think it was 80% of their overall groceries are completely dominated by a single player.
Mm-hmm.
So that is, of course, that goes beyond our scope here. It goes to the FTC and instances of that nature. But what are the practices that they're carrying? But and for us, that's at least one of the explanations that I was able to look for. That it is difficult to fight when you're fighting for such a small share of the market.
Right. And I think this goes to sort of a deeper dialogue with our partners like La Semilla and the folks like that through our food sustainability plan, which I think it sort of mirrors some of what they've increases of like food and not the trouble that we're having with I guess the price of food here as opposed to bringing it in, that kind of thing. And maybe, I don't know if that has anything to do with it, but I'm assuming that it does. And then thank you for the downtown numbers. They're really exciting, and I'll look a little deeper into that. It looks like we're doing really well, right? Like what we've intended to do, so that's exciting. And then the SNAP cases, thank you for doing that. I really have appreciated knowing that you're listening and that your follow-up is great. I'm torn about this in that I know that people feel like, well, the lower those SNAP cases, the better. But I have to remind folks that our people are only on the rolls for 5 years. And so whether they can afford to or not, whether they have a job or not, then they get kicked off the rolls and they're required to then, fend for themselves. And I think that's one of the biggest reasons why we have food insecurity, and those numbers from Casa de Peregrinos and other places where you see that we're giving out major amounts of food is pretty concerning. So is there anything that would suggest that when they drop off, can you calculate the job growth in certain portions? Because I want to say that there's a work requirement, or you have to be, in order to get SNAP. I wish I could be a little more on top of the changes that have been made. But if that's the case, is that why they're dropping off the rolls, because they're getting a job? And is there any way to calculate that?
Mr. Mayor, Madam Mayor Pro Tem, the short answer to that is that there's probably ways of doing that. The longer answer to that is it takes an actual research effort to conduct that.
You told me that last time too. Yes.
So I mean, it's doable, but doable with constraints, of course. It's an actual effort of going after and tracking down and looking at each one. But it is a big research effort, correct?
And finally, one last question. Slide 14, your New Mexico Workforce Solutions, the 438 job openings in your report. Does it specify the kinds of jobs that are required or that are out there, and the types of sort of job training that is necessary to assist? Because we did the Resilience Leaders did a survey of 1,100 plus people, and one of the things that was very glaring in the information around job training and higher ed was many folks were saying there wasn't the job training available that they needed in order to get the job, right? So Doña Ana Community College, maybe the university, the access just isn't there for the types of jobs, I'm assuming, for the types of jobs that are out there. So, so I would like for us to dig a little deeper around what that looks like and how we can help folks, especially those that are unemployed.
Good afternoon, Mayor, Madam Pro Tem. This is Criselda Martinez, Director for the Economic Development Department. You are correct. I think that there is a disconnect between the resources for job seekers and also for employers on the resources available. We have continued to work with Workforce Solutions and Workforce Connections to figure out ways to better connect those dots. And also, 2 weeks ago, there was a roundtable from the State Economic Workforce Solutions Office at the state level. And part of their effort was to understand from the stakeholders' perspective in our community what the plan of their strategic plan would look like from what we see in our community. So a lot of efforts to connect the dots among community members and other agencies are taking place, and so it's not going to be overnight, but we're putting efforts towards making those connections.
Thank you, Dr. Martinez. I appreciate that. Thank you, Mayor Dr. Payares. I appreciate it.
Thank you. Councilor Flores.
Thank you, Mr. Mayor. And thank you for your excellent presentation, Dr. Payares. I really appreciate that. As far as the employment rate goes, you listed the top employment industries, and these are full-time positions and high-paying or relatively high-paying jobs. Is that correct? We don't have a picture, though, of other types of employment.
Mr. Mayor and Councilor Flores, Correct, ma'am. We have a picture that resembles your panel on the left that has the median salaries they earn on a yearly basis attached to it in the full report. So that information is readily available in the report. And if I can recall properly, out of those top 10 industries, about, I want to say 4 or 5 paid an annual median salary with benefits plus all the other stuff of above $40,000, which is our median annual income for household income for Las Cruces.
Is the $40,000 part of the benefits, or is it in addition?
Including everything.
Including everything? Okay. So, you're an economist. So when I took economics in my undergraduate school studies, what I was ingrained with was Weber's stratification, the stratification of classes. And what we were told, what I learned, and I don't know if that stratification still applied insofar as how we reach our analysis and all that. But I remember my professor saying that the Vanderbilts, the DuPonts, were considered lower upper class. The upper class were, I don't know, gods, kings, people who are born with $1 zillion in their mouths, I don't know. And then said that the upper middle class were the nouveau riche. That included, maybe it was the Vanderbilts and the DuPonts. But anyway, the whole thing was so skewed because I always thought we were middle class back in the 50s and 60s. And my father was making a whopping $12,000 a year. But we lived very well. I mean, we had cars, we had, whatever. Things were so different then. So when I learned that in college, I thought, well, then we're dirt poor. We're the poor, there's a lower middle class, the middle class, and the upper class. And within those stratifications, there's lower and upper. So according to what the professor told me, we were lower class. And I don't know what $12,000 a year equates to today, but I do remember that a dollar could buy a lot. Like my mom would send us to the grocery store and say, okay, get some lunch meat, get some bread, get some lettuce, get some onions, and with $1, we'd come back and she'd say, and give me the change. And with 36 cents, we could go to a movie, buy popcorn, and buy a candy bar. So that's just showing you how $12,000 worked back then. And when you can go to the movies once a week and have a new bike, and then when you turn 16, 17, you get a little car or something. So, and then your parents are able to send you to college. I mean, so I don't know how my parents did it, because no one can live on $12,000 today. And the way I see things, I mean, I go to the market and buy a few things, and it's like $12 or $13 for just a few things. So when I see that we have like a $40,000 income, and that includes benefits, that's really not a lot of money. And that's what I think people are calling middle class. And is it relative to Las Cruces? And then when Mr. Nichols says that developers don't want to build, quote, affordable housing, well, they're building out in the West Mesa primarily, and people moving in there are coming from California and selling, crummy little homes for maybe close to $1,000 to $1 million, and then buying something for $300,000, so that's affordable for them. So the whole thing is so skewed, and I would just like to keep that. And that's why we have so many, so we have, and then I was, as far as the employment industries and the rate of employment, are they part-time jobs? Are they full-time jobs? And and then you said, I think you said that the $40,000 is average, and averages, I mean, if you said they were medians, I'd be able to say, wow, sort of kind of wow relative to Las Cruces, but for me, you know, I just have to say that for me, it's really, there's no other word, screwy. You know, just kind of, it's just hard for me to assess how anyone can live on $40,000 a year and consider that middle class. I mean, you can't buy a home with $40,000 today, I don't think. I don't get it. So I would really like to see, I don't know, I would just like to see some, I don't know, it's not for the Economic Development Department, but just as far as a policy or a city as a whole, a community, to see that the needs of our community are really met and get workforce solutions in here, get the bridge and get, I don't know, I guess I'm just talking out of frustration. But your presentation is excellent. It shows a very, very good picture of where we are. And the picture isn't very, very bright when you think about it. And then to hear that, you know, that developers don't want to build affordable housing. Well, affordable it's relative like everything else in life. But it still makes me sad when Mr. Otero comes over here. That's his name, right, Juan? Perdón. Mr. Olvera comes here and talks about, you know, HUD housing that went up in 1963 or whenever, and some of this stuff is probably full of mold and whatever. So all of that paints a very grim picture for me. And I don't know what we can do as a city. You know, let's you know, look out for our residents, for our people, and hopefully we can set up a model here that really addresses all of those things. I don't know. I'm just feeling very, I guess the forecast is bleak. And then with the coronavirus, that doesn't help either. But thank you so much, Dr. Payares. I think that I agree with, I've said this to you before, I've said this before City Council, but I agree 100% with Ioana Bencomo. And I've said this also to Dr. Martinez. I think we really have jewels. We really have a gift in having you in the positions that you hold. And I hope you stay here a long, long time. So if you need a raise, talk to the mayor. No, I'm just kidding. No, all kidding aside, thank you so much, because this is, I think, helping us to create policy that will hopefully enhance the lives and the quality of life of our residents. So thank you very much, the two of you. And thank you, Mr. Nichols, for your grim report on our developers. No, thank you, Mr. Nichols, for your information. Thank you.
Okay. Well, thanks. That finishes your presentation.
Yes, Mr. Mayor.
Okay. Well, if there's nothing further, entertain a motion to adjourn. Motion made by Councilor Flores, second by Mayor Pro Tem Gondara, that we adjourn. All those in favor signify by saying aye. Aye. Those opposed? Okay, we're adjourned. It's 4:57 p.m.